Good morning, everyone, and thank you for attending today's Community Safety Forum to discuss the social challenges affecting community safety and where opportunities for change exist. My name is Mayor Dan Rayner, and I would like to first start by acknowledging that we are hosting this meeting on the traditional territory of the Anishinaabe people, as well as shared territory under Treaty 3. Given the tremendous response to such a forum, this is the first session today that will take place. However, for those who are unable to attend, both sessions are being recorded and will be posted online for viewing later on the City of Kenora's website. I'll be moderating this forum, for which there will be approximately an hour and 40 minutes dedicated to presentations by representatives from the OPP, the Northwestern Health Unit, the KDSB and Nietzsche Friendship Center, and the City of Kenora. The questions that were gathered in advance have been used to inform the subject material of the presentations by the panelists. The question and answer period will follow the presentations, where members of the public will be given the opportunity to ask questions to our panelists. I would like to reiterate that the purpose of this meeting is to provide information about the social challenges affecting community safety and discuss where opportunities for change are present. I reserve the right to stop off-topic or out-of-order discussions. To ensure this remains a respectful and polite meeting, I would ask that the following ground rules be followed. Please, if you haven't already, please turn off your cell phones. For the question and answer segment, I would ask that the speakers please line up at a microphone, and I will indicate when it's time for your question. At that time, please also indicate your name so that we have it for the public record. If a question cannot be responded to, it will be noted and a follow-up response will be provided as soon as possible. We would ask that there's no side conversations or distractions throughout. For those that have never been in this facility before, the women's washroom is through the door immediately as soon as you exit that door. The men's, you go down across the front of the desk and you'll end up back in this corner. So we're going to try and keep it to the 3-hour limit that the target we've set, and we shall go from there. Our first presentation today is Jeff Duggan. Jeff is the detachment commander, our local OPP. Jeff started his policing career in 1998 with the cadet program in Kenora and was hired as a constable in 2002. He has worked in the Northwest region for his entire career in a variety of different units, such as Crime and Kenora Detachment Operations Manager. He is born and raised in Kenora and is married with 3 children. Jeff?
Just stole off my presentation.
Can everybody hear me without the mic, or do you want me to use? I can use it.
Okay, I'll use the microphone. If you can't hear me, please just put your hand up and I'll certainly try and speak up or so forth. So thank you everybody for coming. Obviously this is a topic that we're glad to be here to present on. What I want to do today is to take you through just a general overview of who the OPP is in Kenora, what our command structure looks like, some brief stats. I won't bore anybody with too many stats, but I'll show you some that are important, and just take you through what we as the police can do. There's a misconception that we can do certain things, and if it's not legislated, we can't do it. So I'm going to just take you through some of those laws. I think the most important part of this morning and this afternoon session is that you guys ask questions. So I promise I won't be the longest person up here, and I'll try and keep it relevant and short. So this is the Kenora detachment structure, and this is important because when you see officers on the street, this is who we are. So there's myself. I'm responsible for all the policing services, not only in the city of Kenora, but in the Kenora detachment area, which includes Sioux Narrows, Manaki, as far east as Vermilion Bay and to the Manitoba border, up north to Reddit and Manaki, like I said, and everything in between. So that also includes all of Lake of the Woods, which, as we know in the summertime, is a city upon itself. We had 2 staff sergeants, one in charge of operations and one in charge of human resources, 9 sergeants, 72 constables for a total complement of 84. Everybody always asks us if we're short. We currently have 8 vacancies. What we do know is that the 8 vacancies that we have there has been a commitment from not only the provincial government, but also the OPP to fill all of our vacancies within the next 2 years. And that's not just Kenora Detachment, that's within the whole Northwest and Northeast region. So I want to show you just a little bit of historical data for the city of Kenora. So these are calls for service. These are billable calls for service. This is what the community gets charged for. So that's not our total calls for service, but you'll see a trend that our calls are going up, and that's no surprise. We saw in 2016 the introduction of methamphetamine to our community, and ever since then, you'll see our calls are rising. The bottom chart represents just a comparison from the same time last year to the same time this year. So again, we're trending up, and we're expecting to hit over 10,000 calls for service this year, which is a dramatic increase from 2014. And like I said, this is just billable calls for service, and this is just for the city of Kenora. So we do have more calls for service than what's represented here. I want to take you through some of the legislation that we have to work with, and just give you a brief overview of how we work with that legislation and how that legislation works for us. So the Liquor License Act is probably one of the most common legislations that we're using in the city of Kenora due to our substance abuse and mental health issues. So no person can consume liquor in any other place than a residence or a premises that's licensed. So what does that mean for us? It means that you can't be intoxicated in a public place. And how do we manage that? So prior to 2016, everybody that was intoxicated in a public place used to go to our cells and sober up, for lack of better terms. They used to spend 8 hours in a jail cell. We used to feed them, we used to give them water, and they used to sleep. We know that's not an effective use of our resources, so we reached out to the Detox Center in Kenora to form a partnership with them, where now, not every person we arrest, but a large majority of them attend the Detox Center to sober up. And why do we do that? Because when we take them to the Detox Center, they're provided with people that are trained to watch them. They're provided with counseling if they want to reach out for counseling, and they're provided those resources that we can't provide them in a jail cell. So what we've seen happen is it's a pathway of care for us. We take people to the Detox Center, they're hooked up with services, and they can certainly get into services like the managed alcohol program or any other counseling services that are offered in the city of Kenora. What doesn't happen in most cases, we don't issue provincial offense notices for being intoxicated in a public place. What we found is that there's no means to pay that fine. Those fines are processed through the court. It's very expensive to process fines through the court. And there is really no, there's no punishment for not paying them. In years past, before my time as a police officer, the police officers used to issue provincial offense notices. And when you got to a certain point that you had enough provincial offense notices, you were sent to court, and your sentence was jail. And that doesn't happen anymore, and that's as a result of a case law, R versus Hill. So there is no system where if you get a certain number of provincial offense notices, you go to jail for a certain amount of time. So that doesn't exist anymore. This next chart, I know it's going to be hard to see, but I think our presentations are going to be available to anybody that would like them. So this represents our arrests for intoxicated persons, right from when the program started in August of 16 up until March of 19. The light green line shows the number of people per month that we take the detox, and the blue line shows the people that are taken to cells. And you'll see that we do still take people to our cells, and that's as a result of when we arrest somebody, if they're violent, we can't take them to the detox because the detox isn't equipped to deal with that. So you'll see that number that go to our cells fluctuates, and it is on the rise, and that is because of methamphetamine. So that we do arrest people that are intoxicated by alcohol, that have methamphetamine on board. They are in a state of psychosis. They can't go to the detox center. They have to go to our cells. What do we do with them when they get to our cells? We monitor them, and as soon as we can, we get them out and we get them to detox once that violent behavior stops. This chart represents the amount of people per year that we're arresting for intoxication. As you can see, I mean, the number does fluctuate, but in 2018, our number of arrests for intoxication actually went down. And that's as a result of the partnerships we have with the detox, with the managed alcohol program, and with our complex care group, which I'll talk about later. So when I'm talking about the Trespass to Property Act, this is also one of the sections that we use quite often. So every person who's not acting under right or authority and has expressed permission or proof that rests on the defendant does not leave a premises immediately after he or she is directed to do so by the occupier of the premises or licensed occupier is guilty of an offense. So this section allows us to move people along from private property. And what can the business community or the residents of Kenora do to help us with that? So absent of somebody that is working or a resident that's home, if there's a sign posted that clearly states that entry is prohibited or loitering is not allowed, that allows us to move people along. So that will allow our officers on foot patrol to move people along that are sitting on stairs, that are sitting on private property. What we can't do, and it's in a slide later, I'll talk about it now, is we can't remove somebody from a public area that's not doing anything wrong. So we can't just come along and tell people to move along that are sitting on a park bench that aren't doing anything wrong. There is no lawful authority for us to do that. And we're often asked by the business community, we're often asked by people that are walking on the street, look at these people, they're sitting on a bench. They've been sitting there for 10, 15 minutes. And they have the legal authority to sit there. There is nothing we can do about that. If they're not drinking in public, if they're not yelling and swearing and causing a disturbance, there is absolutely nothing we can do about that. So these are just some of the common signs. I know this presentation was given at the Kenora Biz and the Kenora Chamber. So they just wanted an example of the signs that you can get, you can make. You can get these off the internet. That's where I got them. Print them out, put them in your front window if you own a business. If you're having problems with people sitting in your yards, or if you're living in a place where there's high traffic, you can certainly post one of these signs. And if we're on patrol and we see this, and we see somebody sitting in your yard, we'll stop them. We'll ask them to move along. We do it all the time. Like I said, so we can't move people off public property unless they're doing something wrong. We also can't be everywhere all the time. We have increased our foot patrol hours in the downtown core. We've increased our foot patrol hours in the busy areas that we determine by analytics. But we can't be everywhere all the time. We can't respond immediately to some calls because we have to prioritize our calls. If somebody calls us and they tell us, there's somebody drinking outside of such and such an address, we will prioritize that call. And if there's officers available, we'll respond right away. But what the community has to understand is that we do have other calls in the queue. We have serious calls, we have serious crimes, so we're going to respond to those first so nobody gets hurt. It doesn't mean to say that nobody's going to respond to this. Somebody will respond because we don't clear calls off until they're responded to or dealt with. So if we can't respond right away, these calls will sit in what we call our queue, and we'll respond to them as quick as we can. Talk about the Safe Streets Act of Ontario. This is a section that we often use, and we'll use this in conjunction with certain businesses such as the mall. We did a project at the mall some time ago where we really relied on this section. And I'm not going to talk about it all, but there are certain things in this section that we can enforce, and they're highlighted in the block. And we do. If we get calls for service, we'll lay charges under the Safe Streets Act. It's a provincial offense. We usually start with Part 1 or Part 3 summonses, so either a monetary fine or a court date where you show up, and we've had some success with this. It does take up a lot of court time, but we have certainly had success with this act. It is quite a lengthy section, so if you do want to read it, it's available online. Cause disturbance. Everybody not being in a dwelling that causes a disturbance in or near a public place by fighting, screaming, shouting, swearing, singing, or using insulting or obscene language, by being drunk, or by impeding or molesting other persons. It is an offense. We can make an arrest for this. If we made an arrest for this in every case, we would need another courthouse, we would need more judges, so we have to use our discretion when we're dealing with this. If there is another section that we can use, we'll also use that as well, because a lot of these are overlapping sections. So, obviously if somebody is fighting, that's an assault, that's different, that's under the criminal code. We will investigate it as an assault and lay charges. Generally what happens with this is officers will attend a cause disturbance call, they'll end the disturbance, they'll investigate it, people will go their separate ways, and it will be done with. The last section I want to talk about is breach of the peace. This section was really created for public disorder, protests, and things like that. Every officer that witnesses a breach of the peace and everyone who lawfully assists the peace officer is justified in arresting any person whom he finds committing the breach of the peace. But the important part of this section is that when the breach of the peace is over, the person has to be released, which often happens as soon as they get in the back of the police car. The breach of the peace is over, they have to be released. So I know, and we had questions submitted prior to, and I know there was some displeasure. I know there was some displeasure with people having to submit questions prior to, but the reason for that was really for us to get a sense of what people wanted us to talk about. Of course, we're going to have a question and answer period after this, so I just wanted to address some of the things that people asked in those questions. What can be done to reduce crime and disorder and calls for service? So we have increased our foot patrol and police presence in the city of Kenora. Our foot patrol numbers are up. I think people downtown are seeing us more. That's what I'm hearing. I'm out in the community often, every day of every week if I can be, if I'm not doing something else or out of town. And I'm talking to people downtown and they're noticing an increased foot patrol. So that is what we want. We want people to see us more. That is a crime deterrent. But we can't always be on foot patrol. We also have to answer those calls for service. The second thing we can do, and we're doing and we have been doing for a long time, is working together as a community to solve the root causes of these crimes, which are mental health and substance abuse. And I don't think anybody in this room would dispute that. We can certainly, we have to work together. We're not going to arrest our way out of this problem, and that phrase has been coined by many before me, but it's true. We can't just arrest and release. We have to work together as a community. And what the community might not know is that we are doing that already. I spend a lot of my time at meetings with other community stakeholders, and we're talking about these issues and how we're going to solve them. Because I can't walk to the table and say, I have a solution for everything. We have to work together, and you'll hear that today with the other presenters. We have to provide supports needed so individuals can break that cycle they're in. Like I said, arrest, release, arrest, release, arrest, release. If we're going to do that for the next 50 years, we're going to reach out to the provincial and federal government, and we're going to ask for more jails and more courthouses and more judges. And that's not a long-term solution, because that's just a cycle that never ends unless you stop it. We have to work with the residents of Kenora to report all crimes and ensure that we're well positioned to deter crimes. So we can't investigate something unless we know what happened. Oftentimes I'll get calls at the office that say, did you see this online or did you hear about this? And I'll say, no, nobody called us, right? So the business community says we've had 70 thefts from our store in the last month. What are you doing about it? And I go on my system and I look up the address, and we haven't had any calls to that business. There's nothing I can do about that because I don't know about it. So people have to call us and report the crimes that they're seeing. They also have to be well positioned to deter crime. Like I said, we can't be everywhere, but there are things that people can do, businesses, residences, to deter crime themselves. So when we talk about residences, one of our most or highest calls for service is thefts from unlocked vehicles. And I know people forget here and there to lock their vehicles, and yes, it happens, but we get a lot of calls, generally at 7:30, 8 o'clock in the morning, for people saying somebody stole money out of my car. We attend, we investigate it, we canvass the neighborhood. We will fingerprint your car if you want us to solve that crime, but that will completely ruin your car. But what is easier is just make sure you remind yourself, or set a reminder on your phone to lock your doors. Lock your doors in your car, lock your doors in your shed, lock your doors to your house. And I know that this used to be a community where you didn't have to do that, but times are changing all over the world, and we need to keep up with times, and we need to lock our doors. We need to lock our garages. We need to put our high value items out of sight, locked up, out of mind. Like I said, we're working with all stakeholders. We're working with the business community. We're working very close with the federal and provincial governments to increase funding for addictions and mental health. And we know that we're getting increased funding for addictions and mental health. And as a community, we're coming together to say, what's the best way to use those funds? How can we do that? Because I'm not going to come to a meeting with the federal and provincial government and say we need to use it this way. We're going to come as a group, and we're going to come and say we need to use it this way, and that's what's going to meet all of our needs. One of the biggest things that we're doing, in number 6, is we have a group in town that's called the Complex Care Group. So I have the ability, and so does the hospital, and so does KDSB with the ambulance calls. We have the ability to run in our system who is using the most services per month, per year. And we can compare those names to say, you know what, these 6 people are using the most services in Kenora. What can we do as a group to get these people the help that they need? So as a result of that, and I won't mention names, but you'll see downtown that you don't see some of the people you used to see every day. A lot of those people that we used to deal with every day and used to see every day, and everybody used to know them by their first and last name, and you used to know where they were sitting and where they would go for certain things. You don't see them anymore. And in most cases, it's not because they passed away. It's because they've been provided resources to get somewhere that will keep them off the street, that will keep them out of custody, that will keep them away from the hospital and the ambulance service. Simple things, they're elders. Where should they be? They should be taken care of. They need to go to Birchwood. They need to go to Pinecrest. These are places that can care for them and keep them off the street. What is being done by OPP and stakeholders? So we have, like I said, we have increased our foot patrols. We meet regularly with stakeholders that are involved in the service hub and the shelter. Police have engaged in discussions with concerned business owners and residences. Make no mistake, if I'm on foot patrol and we want to talk about something, it's not an inconvenience for me. Just let's talk about it, because if you have a concern, I guess to put it bluntly, this is where the rubber meets the road. I'm the boss, and if you have a concern, we can certainly deal with it. We meet regularly with the Lake Woods Hospital, CMHA and other mental health service providers, current Chiefs Advisory, to see what we can do to do better, what we need to go to do in the future. We have a rapid intervention services Kenora table, so a risk table that sits every second Tuesday, and there's 35 people that come together and sit at that table. And we bring acutely elevated risk people to the table. So again, we're looking at the people that are using the most services, the people that are at acutely elevated risk. Who in those 35 people can look after these people? So that's something that we do every Tuesday. And it's worked. We've made several referrals, gotten people into treatment, several things. We're also available to meet with business owners and residents to talk about theft prevention, robbery prevention. We have kits to give out. We have tools. We have a great internet site that talks about all those things. We do sit on a committee with the Northwestern Health Unit that talks about the needle exchange program. And I'm not going to talk too much about it because I know Julian's going to talk about it. But what I think the community needs to know is that we do sit at tables and talk about problem areas or issues going on in town. So it's not an isolated, the Northwestern Health Unit and ADSB, they're not isolated in their own offices. Everybody here has my cell phone number, and you will too at the end of this presentation. They call if they have a problem, and we call them. We are heavily involved in community mobilization and upstream crime prevention initiatives, and those are things such as the risk table, the community safety and well-being plan, which I know Adam's going to talk about. That is being revised this year, and that is a great avenue for people to come and voice their concerns. Where do you want this community to go in the future? Where do we want to be on that roadmap for success? So I would certainly encourage everybody to come out to that public forum that we're going to have come September and October. There was a lot of questions about people that end up in Kenora for certain justice-related issues, for health-related issues. I can tell you that there is a program to get people home, but we can't force people home. There are people that choose to make Kenora home, and we have to support them when they're here. If they want to go back to their home communities, there's funding available to do that. And we will certainly do that if that's where they're willing, if that's where they want to go. But I can't force somebody to get in a taxi to go to Sulakau, to get on a plane, fly home. Once they're done their sentence at the district jail, or once they're released on conditions to live in Kenora or to live at home, if they're released on conditions, we can force that. But if their sentence is complete and they choose to make Kenora home, there's nothing I can do about that. And there's nothing I can do about tourists that come here and make Kenora home. It is what it is. Housing first approach. I know we'll hear about that today. It works, and it's worked in other communities. And what that housing looks like is something that we have to collect the data for. And we know that KDSB is going to talk about supportive housing and housing units and transitional housing. This approach works. It gives people a chance to break the cycle. I'm not saying it's going to work in every case because nothing's 100%. But what I'm saying is at least it gives somebody a chance to break that cycle of rest, release, and rest, release. Again, I talked about the community safety and well-being plan. It is coming up for a review in this fall, and it's mandated by the province. We have to have a community safety and well-being plan. And we created ours in 2015. So we're well ahead of the mark on this. We were the first community, one of the first communities in Canada to have a community safety and well-being plan. So what can't be done? Again, issues overnight. These issues have been present for many years, and we can't expect an overnight solution. We cannot step outside of our legislative authority to fix these issues. So I'm talking about on the street, we can't step outside of those authorities. We can certainly step out of our mandate to attend community stakeholder meetings and be part of tables. But when it comes to stepping outside of any legislative authority to move somebody along or to arrest somebody, we can't do that, and we won't, because there are civilian bodies that hold us accountable. Like I said, we can't arrest our way out of these issues, and getting to the root cause of solving that is the only way to progress. Can't choose who makes Kenora home. We can't report crimes if they're not reported to us. And I'll talk about the methamphetamine, I call it a crisis because all of Canada is in a methamphetamine crisis. Some people are still seeing opioids, but ever since 2016, we've seen an increase in methamphetamine use. I'm sure there'll be a lot of questions about that, but it's a reality. It's here. We were warned it was coming. We never thought it would come, but it's here. And we are strategizing and trying to deal with that as it comes up. We do have a drug enforcement strategy. Obviously, I'm not going to talk about that because that's something that we can't share, obviously. But just know that we do have an organized crime enforcement bureau. We do have a community street crime unit. Our officers are well positioned and trained to deal with methamphetamine use and methamphetamine dealing. Felix Munger, we do a lot of work with Felix, and I saw this quote. And I think it just encapsulates what we need to do as a community. So we need a public health approach, which would create partnerships with social services and health practitioners, and need to intervene before crimes happen. And that quote, I think, best sums up what we need to do as a community to try and move forward and move past this. So, everybody get their phones out. This is my contact information. And I'm not scared to take calls. My cell phone number is on there. My email is on there. I live here. I work here. Call me. I'll take calls. So, but what I'll tell you is that if you're going to call me to report a crime, please don't. Please call the numbers that are on the bottom. Because I do get calls from people saying, somebody just stole something from my store, and I've got a fishing rod in one hand and a 2-year-old in the other. So there's not much I can do with that. So if you're going to report a crime, you need to call the numbers below. For emergencies, call 911. Our non-emergency number is there. Our local detachment number is there. And call them. So I know we're going to open up to questions after. I want to touch briefly on our new office that's going to be downtown. And there was a media release that came out that said that the public could report crimes there. That's not the case. That office is being opened up for us, for our officers to work out of. It's in conjunction with the Current Chiefs Advisory. It's in conjunction with the new youth hub that's going in. So the public will not be invited there to report crimes. It is a space for our officers to work out of, to increase our presence downtown. They'll be parked on Main Street. They'll be working in that office. They'll be able to respond quickly to downtown calls. Our youth crime officers that are in conjunction with our Chiefs Advisory will be doing a lot of work out of there with at-risk youth. But subject to the media release that came out from our corporate communication and missed my email, it's not for people to report crimes in. We still encourage you to call the numbers that are on the screen here to report crimes, or if you see somebody, flag them downtown. So I know we'll take questions after, and thank you very much for coming. It's a great turnout. I know we're going to do this again tonight, and thank you very much.
Thanks, Jeff. Our next presenter is Jillian Lunny, who is a manager of sexual health and harm reduction at the Northwestern Health Unit. Jillian has been a registered nurse for 20 years and has been working in public health for the past 15 years. Welcome.
Hi, everybody. I echo Jeff's sentiments. Thank you to everyone who's come here tonight, and thank you to everyone who submitted questions about the needle. Oh, sorry, is that better? Yes. Okay. If it's too loud, just put up your hand. My boss yesterday told me I needed to speak up, and right away I didn't do what she said. So I'm really the Needle Exchange Program is one of the programs I manage, and it's a misunderstood program, and it should be. There's not a lot of us that have that lived experience or know people directly who inject drugs. And so I appreciate the questions that you all submitted. They were very well thought out. They're the questions we most typically get about the program. So I went through them all, I read them all, and I themed them, and they kind of fell into these 4 categories. Why do we have a needle exchange? Why do we have to have one? Why don't we have a one-to-one exchange? What are we doing for NEP, Needle Exchange Program in Kenora, and what is outreach? And what are we doing about needles on the ground? So those are things I'm going to cover today. A bit of a caveat though, I'm going to be talking part of the time about needle exchange compliance. And so the population potentially that we're here to talk about today includes some people who are needle exchange clients. Not everybody who is homeless, and not everybody who is downtown is a needle exchange client. And those aren't all of our needle exchange clients. We serve people who have homes and have jobs as well. So the population I'm talking about is kind of a subset of that, and it might be a little bit different. I When I say needle exchange program, I am more than sure that this is what most of you picture. I sometimes wish needle wasn't first in our title. I wish it was called an HIV prevention program, because that's what it is. This is what we see. This is what runs the dialogue on social media and with media as well. So, and not just local media. These are all local media pictures just recently. Some of the articles didn't even mention needles, but Safety Forum held tonight, and it was one of these pictures. Not to pick on local media, because I know you're here. Nationally as well, you look at any story on opioid overdose deaths in Canada, tragic. Thousands of people, young people dying every year of opioid overdose, and the picture will be one of these. Most of these I don't even think are from Kenora. The only one I know is that middle one. And there aren't any needles in the picture, actually. It's all just soft plastic containers. We're going to talk about needles on the ground tonight, and that is important. It is an important part of our program, and we know how important it is to all of you. And we're going to talk about that tonight, or today. We're not at tonight yet. One day. But just for the next 20 minutes, I'd like you to have a snapshot into what I see and what I visualize when I think about this program. I've been doing this for 15 years. No one gasped that I've been a nurse for 20 years. How can she? She looks so young. Anytime, Sophie. This is what I see. This is what I see every day. This is our nurses in Kenora. This is our staff in Kenora. This is our staff in the region. Giving out needles is one thing that we do. And what you see in these pictures are our valued partners. This is work we do in our community every day. This is us advocating for care for people who don't always get it. This is us intending, getting skirts made. It was a really neat opportunity for my team to get skirts made to learn about the Indigenous culture. It's really important. We do, and our team's been doing it for a number of years now. We've had some great mentors to help us learn about the Indigenous culture. This is us with clients. When you talk to my staff that work in the needle exchange program, if you were to hear them talk to me as their manager, if you were to hear them talk to our Board of Health member, if you were to hear them talk to our clients, you will not hear a difference. It's all the same to them. They believe that people inherently deserve respect, and it's part of human rights. So these are the pictures I'm going to have in the slides today. But we will talk about needles on the ground as well. The question's answered. Why do we have to have a needle exchange program? Bottom line, we have to have a needle exchange program because 30 years of evidence have showed us that it is best practice to prevent HIV among the injection drug using population. 30 years of global evidence have told us that. It's like a condom. For sex, it's a needle. I know our emotions go up when it's a needle. But it's the same thing. 30 years of evidence have shown us this. Our program is mandated by the Ministry of Health and Long-Term Care. So we often, my social media circle is very small, but I tend to look a little broader coming up to sessions like this so I get a sense of what's going on. I see a lot of posts about the city should shut down this program, the city should do something about it. It is mandated by the Ministry of Health and Long-Term Care in a document called the Ontario Public Health Standards. 35 health units in Ontario, and the Ontario Public Health Standards mandate all of the work we do in public health. So there's a standard called Infectious and Communicable Diseases Prevention and Control Standard, and that's the standard that lists all the work we have to do in public health in regards to infectious disease. The infections that are that I have, no. No, I don't. Raise that down, John. The infections that I manage and that I do surveillance for are the ones that are sexually transmitted and bloodborne. So the ones we're talking about today, in particular with the needle exchange program, are HIV and hepatitis C. This is where it says in the program outcomes. I've just put some quotes from the Ontario Public Health Standards. You can Google them. You can find them yourself. Point A. So we have to ensure that sterile needles and drug preparation equipment are available to people who inject drugs. I'm not going to read through the whole thing, but point B is that we have to provide and ensure the availability of initiatives related to the disposal. So we have to make sure that sharps containers are available so that our clients can dispose of their needles properly. We're not mandated to go out and pick up needles. We honestly work a bit outside of our mandate because we all live in Kenora. We have kids in Kenora and we care about Kenora. We do more than we're mandated to do, and we do it gladly. All of these agencies are just examples of agencies that support needle exchange programs. I'll have the links in the bottom so you can click on all of them. Really interesting evidence. So there's a common sense element to needle exchange programs. So if I was to offer a flu shot clinic here today, okay, not flu shot, I don't want another debate. Let's say a Hep A, I'm taking you all to Mexico, you can all get your Hep A shots today. And I offer you a choice between, I'm going to give you your Hep A shot, I can use a new needle, or I can use a used one. I don't know who used it, someone did. Which one would you like me to use? I mean, nobody, right? No one's going to pick the used needle. Besides that, we've also done global studies. In the mid-90s, HIV started switching from the men who had sex with men population and into the injection drug using population. And so at that time was a perfect time to do quantitative comparative studies to look at what happens with unstable HIV rates. People were injecting drugs in both types of cities, so injection drug use happens where needle exchange programs do not exist. Needle exchange programs were a reaction to injection drug use in the HIV epidemic. We didn't invent the needle exchange program and cause injection drug use. 1997 global studies, they looked at 52 cities without needle exchanges and 29 with. And what happened? HIV rates changed. So the cities that had needle exchange programs, HIV rates went down. The ones that did not, HIV went up. Another one in 2002, 103 cities from 24 countries. All that changed was the HIV rate. Drug use did not change. A lot more evidence on that. Interesting in this 120 literature review that there's also no persuasive evidence that needle exchange programs increase initiation, duration, or frequency of how often someone injects. So if there's this idea, what we often see is that harm reduction programs and needle exchange programs do not cause harm. We don't make people inject drugs. We don't want people to use longer than they want to. Just because we serve a severely addicted population doesn't mean we don't want them to get better. I'll show you some stats on that in a little bit as well, and on the work we do to help people get into treatment. Also, needle exchange programs can increase recruitment into treatment. So people who inject drugs often don't have a lot of open doors, like a lot of us have. You can go to a needle exchange program and assume you're going to be treated with respect and like a human. And more often than not, and I hear this across our country and I hear this across Canada, that needle exchange programs is often where people come when they are ready to get better. We are there for them when they're ready to get better. And they're cost effective. I'll have a slide on that in a minute too. I can keep going on the research, but I'm just going to assume you believe me now. World Health Organization did a huge literature review as well. So needle exchange programs persuasive evidence that they decrease HIV, but they also do not cause harm. It's that idea of enabling. So I handle needles most days. I have for a really long time. Addiction is way more complex. The decision to put a needle in your vein and inject a drug is more complex than the presence of a needle. Otherwise, I would do it all the time. Even the availability of a drug doesn't make me use drugs. So I have a water glass down there, and I could have vodka in my water glass. Right? I have the means to buy vodka. I have the money. I have the car. I don't have to risk being arrested. I could have vodka in my water glass. I don't. I thought about it. But I don't. And why don't I? That is where addiction comes down, just because I don't have to. I'll put the YouTube video in. This is so great. No, it's not great. It was terrible, but it's a really interesting story. So Scott County, Indiana. Up until 2015, needle exchange programs were illegal in Scott County, Indiana. Spoiler alert, injection drug use was happening in Scott County, Indiana. It's a very poor area of Indiana, 24,000 people. And the injection drug use was happening. People would find needles on the street, and they would use those needles until a month and a half, they would use those same needles. This is Brittany Combs. She's in the video. She's a public health nurse working in Scott County, Indiana. Prior to 2014, she never worked with people who injected drugs. She believed they didn't deserve care. She thought working with them enabled them. She didn't know anything about HIV. They did not work with them at all. They had the worst HIV outbreak in American history. Towards the end of 2014, starting in November, up until March, April of 2015. 250 cases in a city of 24,000 people among injection drug using population. Mike Pence was governor. I might not have to say more than that, right? But so this is why needle exchange programs were illegal. There was a lot of comments written to me about morals, right? I morally don't agree with this program, and our morals are so important, right? It's the idea of ideology versus evidence. So sometimes we can be given a lot of evidence, but it just goes against what we think. I was doing a presentation in a different community recently, and at the end, a guy stood up and said, "I can't argue with what you're saying. I can't argue with what you just said." I said, "Well, thank you." And he said, "But I can't agree with it. I can't get myself to understand. How do I reconcile this with everything I've learned growing up? This is enabling. I feel like it is. I know you're telling me it's not, but it is." That's what Mike Pence was going through. He was pressured to declare a public health emergency. He was pressured to start a needle exchange program, and he wouldn't do it. Finally, he called the sheriff in March of 2015. They were up to almost 250 cases, and the sheriff, who had been against needle exchange program, said, "I'm against him too, but you know what? We don't have a choice." March, he declared a public health emergency. April, he implemented the needle exchange program. By November, there were no more cases of HIV. They've done a retroactive study. Yale went in and did a study after the fact, and it all could have been prevented. Why don't we have a one-to-one exchange? So this gets asked a lot on social media, just into the people yelling it into the void, and it was in the questions. This is the idea of you have to give a needle to get a needle. So if Mayor Dan looks at the needle exchange and I say, "Hey, I have 5 needles, he'll give me 5. If I have 10, he'll give me 10. If I have 1, he'll give me 1. And people think that this is a way to prevent needles being found on the ground. So there's a reason we don't have that. So evidence shows, so if we don't give people what they need, if we don't give people the needles that they require, so if we follow that through a little more, if I go up to our mayor and I say, "Hey, I need a needle," and he goes, "Well, you have to give me one." And I say, "I don't have one." Then he doesn't give me a needle. What do I do then? And what I don't do is say, "Oh, you got me. Today's the day I'm going to get better." Right? If I'm going to use, and I'm going to find a needle, and that needle might be a used needle. So it goes against what we're trying to do in this program. Red, why does the Northwestern Health Unit have a one-to-one exchange like BC? BC does not have a one-to-one exchange. Please, if you see this, please help me out. BC does not have a one-to-one exchange. You can just Google it. They don't. We've learned from people who have tried this. Ottawa tried this. So when they had an HIV outbreak in 1991, they implemented a needle exchange program and thought, conservatively, let's put in a one-to-one. Let's try this. It seems like it's a good way to go. Their HIV rates continued to increase until they got rid of the one-to-one exchange. Right? So we increased to 200 infections by 1994. In 1996, they removed the one-to-one exchange. And from 1996 to 2002, the rates went down to 60 per year. They learned their lesson and we learned it from them. More states. California did a comparative study and they did the same thing. We share more when we don't have the supplies we need. A national best practice document says the same thing. So health organization says it, everyone says it. And they actually focus on the opposite. And I know this can be a bit hard to hear, but if we want to prevent the spread of HIV in the lung injection drug using population, we have to make sure that they have a needle for every time they use. And so we sometimes worry a bit more about who they have enough. We know from a survey we did a couple of years ago with our clients, that people are injecting many times in the future, sometimes 12 times a day. And I know that can be really hard to hear, and we live this every day, and we get kind of used to it, and that can be a really hard thing to hear, but that is reality. And we have to make sure people have a new needle for every time they use. Again, more evidence. Ministry of Health and Long-Term Care, I asked them, and they said no one in the province does it. There's only one place in Canada that does one-to-one exchange, and they get that. What happens when you have a one-to-one exchange? This is Saskatchewan. You probably know about Saskatchewan in the news. You don't need to go to Africa to do HIV humanitarian work. You can go to Saskatchewan. It's unbelievable. Look at their rates. So ours are stable in Canada. They're stable in Ontario. Saskatchewan is the only province so far that's looking like this. So what happened in Saskatchewan? So one of our jobs in public health is whenever we have a new infectious disease, we find out about risk factors. How did someone get that infection? The yellow is what you want to look like bright yellow. So in Saskatchewan, 71.4% of all new cases identified that they inject drugs. That is the biggest risk factor in Saskatchewan. Look how small that is in Ontario. Because of our new exchange programs. So, here's what happened in Saskatchewan. People sometimes say the Northwestern Health and Needle Exchange Program is an abject failure. And people, I think, most often say that because sometimes needles are found on the ground. And we think that that should be the goal of the program, to not have needles found on the ground. It's the goal of ours. Don't get me wrong. And that is what Saskatchewan focused on. So in 2008, this is from their HIV report. They called their program successful because they had a 90% return rate. That's what they focused on. That's what their goal was. In 2009, the Premier caved to public pressure. They didn't like the needle exchange program, so they limited and restricted the program. And look what was happening to HIV budget. It's not a successful needle exchange program. Here's where they are at now in Saskatchewan. They continue to lead the country in rates of new cases of HIV and Hep C. The major risk factor is injection drug use. They are the only province in Canada where the leading cause of HIV is injection drug use. The cost effectiveness, this comes from the Canadian AIDS Society. It's estimated that each new case of HIV will cost $1.3 million per lifetime. The needle exchange program is cost effective. Preventing chronic disease, whatever disease you want to talk about, diabetes, heart disease, it is always cheaper to prevent those infections than it is to treat people once they have them. An average of 1.3 million for one HIV case, and it's a lifelong infection. This is where Saskatchewan is at now. This is part of my job in public health. The dark blue is not good. Okay, so this is where higher rates of HIV are. Look at Manitoba. Manitoba. This is median, this is we're not fighting this. This is our reality. This is what we worry about today. In 2012, Saskatchewan health officials warned Northern Ontario about an HIV epidemic that was coming their way if they didn't fix their problems. They said that the environment, this is in the Wallace News in 2012, the environment that we were facing in Northern Ontario was the same as Saskatchewan before the outbreak started. In 2012, I worked with the Seward Upper Regions Health Authority, and we implemented needle exchange programs in flying northern communities in north of Seward, and we had to have an HIV report. They are now finding mutated strains of HIV in Saskatchewan. They can't figure out how to treat them, and harm reduction programs still remain ongoing. When we look at the success of our program, this is one of the things we look at. We did a survey of 140 of our needle exchange clients in the region a couple of years ago. I've never seen stats this high. This was, we don't often just sit back and give ourselves a pat on the back, but we did. Virtually none of our clients are sharing. That is how we are going to keep an HIV outbreak continuing tomorrow. So to us, this is a successful program. It's actually a very successful program. How many needles do we have? We give out however many we need, and these are sad statistics. Our rates went up exponentially when OxyContin around 2004, 2005, when it first hit the market, and started going up again when it was delisted in 2012. I know this can be hard for people to see. I don't know if there's a number that people would find easier, but this is the need in our community right now. Our return rates, on the bright note, in 2012 our return rate, the number of needles we got back was only 20% of what we gave out. We gave it a huge priority in our program to get back more needles, and we're getting there. This past year we're up to 79% return rate on the needles we gave out. This is what we offer through the Northwestern Healthcare and Harm Reduction Program. We offer a needle exchange program. We offer an opioid overdose program, right? It's killing thousands of people in Canada every year through overdose. We give out naloxone kits. We provide a safe needle pickup and disposal program, and in Kenora specifically, we provide outreach. We're really proud of this team. We have nurses who started walking around downtown all the time and help the people that weren't coming to see us. And it's just slowly grown. We have a lot of partners that we work with, and it's going really well. Again, there's something that Beth had already pointed out. We as well have a lot of partnerships. People say we give out needles like candy. I take that to mean just sitting, just carelessly throw them out our window, or and we don't care, right? It's just something we do for fun. These are regulated healthcare professionals that are providing evidence-based harm reduction services to people who need the care. Only part of our time. The rest of the time we're doing this, we want to see changes in our community too. And we bring different perspectives sometimes than other agencies at the table, but all perspectives are respected and we all need to be there to make a change. There's not one cure for this. We can't have one perspective at the table. These are some of the groups we work on. We also do substance delay work. So again, we want our clients to get better. And sometimes we try to get them out of their using environment, even if it's for an hour. You can't get better until you start healing. And so we do that through art, we do that through music, and just connection sometimes. Here are some stats from our outreach van. So we've been on the van, I think, two years. This is just January until July 13th is when I pulled the stats. We do far more than giving out needles. A lot of someone asked about, do we do testing through needle exchange program? Absolutely. If people are going to have HIV or to get HIV, we want them found early, because the sooner you can get diagnosed, the sooner you can get treated. If you're on treatment for HIV, you can be untransmissible. It's really important. Dr. Grech, thanks to the Lake of the Woods District Hospital, we've been able to fund a physician. If you haven't met Dr. Grech, over the evening session tonight, new to Canada, new to us. He's a great guy. And he's been coming out on outreach. The Lake of the Woods District Hospital is funding it right now. And he's been coming out to provide preventative primary care, to provide things that nurses can't. So he is seeing people with broken bones and conditions that haven't been treated in years. He has done 8 applications to get people into addictions treatment. You have to have a physical to get into treatment, so you have to have a doctor who can do that. So lots of barriers for a lot of our clients. We've done 8 of them so far to get people into treatment. And coming up, we're going to have 7 people on hepatitis C treatment to get rid of their hepatitis C to help bring rates for in our area. What are we doing about improperly discarded needles? This is the area that I think sometimes is the most challenging for us. It's always a moving target. This past year, I think, has been in particular a lot of changes, and the places where we used to find needles, things have been moving, different locations, and we're doing our best to keep up with it. A needle on the ground is a harm for everybody. It's a harm for a community. This is something nobody wants to see, including us. I have people call sometimes, I'm so mad I found a needle on the ground. And you're mad. We give out sharps containers. If someone called and said, hey, I'm in the back alley and I just injected and I have a needle in my hand, our nurses would fly out of the building like their butts were on fire to go pick up that needle from that person. It's really frustrating. Our clients face barriers, we know, but we want to do our best with this, and we try. We really do. We'll come pick up a needle. You can call us. We have an email grouping at the Northwestern Health Team. If you find a needle on the ground, you can call our front desk. You can say, I found a needle. Here's where it is. Please be specific. I had a call in that there was under a bench on Main Street. I didn't know there was, so I had no idea. I was like, oh, there must be one bench on Main Street. Never paid attention. Pouring rain 10 at night. I found it. You can call us, and we'll pick them up. We also provide tools and resources. We provide the plastic yellow containers to washrooms that need them, so like the public library. It's becoming pretty commonplace. Airports, a lot of people have the containers in their bathroom now. It's just part of occupational health and safety. We also have these outdoor black units. I think we have 5 more that are pending going up based on where we've been finding needles in the community. We're just working with the city to get those up as well. I think we have a list on our website of where they are. We also provide safe needle pickup kits. So we get criticized on this because I shouldn't have to pick up a needle if I see it. no, you shouldn't. I hear you. I row. I go down to the rowing dock sometimes on a Saturday morning, and it's just covered in garbage. Just bottles and clothes and tons of garbage. And it's probably a worldview for some people. My view is that I pick it up. I sometimes swear under my breath a little bit, but I pick it up because the well-being of my community means more to me than some generic point I'm making by looking at there. So it's just the way I've always been. My kids, Liam, pick that up. I picked up there, Molly did. Just pick it up, right? So that's not why. We're not asking people to do this because we're shirking our responsibility. We're doing it because, firstly, our capacity is a bit tight, but also because if you leave it there, we might not get there for an hour. Right? Like if we have sexual health clinic, we have other things we're doing, there's going to be a delay. And so we encourage people, if you see it, if you feel comfortable, please pick it up. We encourage people to do that. We will do the training. We will also come do it if you don't want to. It just, you have to know it might be left on the ground for longer than it should be there. But we'll get there as soon as we can. But we do have safe pickup kits if you're interested in having one. We give out tons. And we've had really good feedback. We do a lot of training with downtown, and we have a lot of agencies that help us with this. A lot of education we do, media release every year. The Kenora Needle Action Partnerships. When I did the presentation here in November on this topic, people stood up at the end and said, how can we help? Tired of complaining, tired of dealing with the complaints. So we started the Kenora Needle Action Partnership. It was like 4 meetings before we came up with our name, but we got there. And it's people from the health unit. It's
Hey Dan, and also thank you for everyone for attending our first session in relation to the Community Safety Forum. I'm going to try to be really quick. I think everyone went over, so but certainly, and I think if we are a little bit truncated in terms of time, there's a number of us on the panel that will probably linger around for any further questions. So we'll be more than happy to do that. All right, so just give a brief overview of my presentation. So I'm going to start by going over the City of Kenora and our relationship to community safety. I'm going to come from more. I'll be coming from more of a development perspective, given my position at the city. I'll then look into some of the recent initiatives we've pursued at the municipal level. Some of the next steps. So many of the questions and concerns related to, what is the action plan? What's coming down the line? Then I'll talk about, and I think it's important to note, some of the successes we've had as a community, instead of being so shrouded sometimes in negativity. So first and foremost, we have a financial stake in community safety. As you can see from this paragraph indicated here, this is from our operating budget of last year, that almost 30% of our expenditures are dedicated towards the OPP, Northwestern Health Unit, as well as the Kenora District Services Board. I think if you look at policing in particular, in 2019 alone, our costs rose by 7%. So the provincial average is about 1.1%, which is quite small relative. And if you put it on a per capita household basis, our average cost is $786 per household, whereas it's about $359 per household for the rest of the province. So there's quite a discrepancy there, and nonetheless, undoubtedly, we pay among the highest policing costs across the Ontario. Community safety is also a principal development. So if you look at our official plan as well as the provincial policy statement, there are a number of principles we have to follow whenever we're developing recommendations that may go to council from a land use perspective. And so all these are really create the policy context for those recommendations. And that comes into play whenever there's a change of designation or of zoning. Also, when it comes to even after development is approved, we still have site plan control. So through things like landscaping, some of the other external kind of measures, we're able to put forward some stuff that can actually have a positive impact on crime prevention. I know I've noted this in a few sessions previously, but I think it's very important to remark that a principle of our work is, and it aligns with the Human Rights Code, is that we can't zone for people; we have to zone for land use. Evidence has shown that the best outcomes, best social and economic outcomes, are when you have mixed neighborhoods of various income classes, of various races. So moving into some of the recent initiatives. So back in 2018, the city joined the Canadian Municipal Network on Crime Prevention. And this network is basically a core of municipalities across Canada dedicated towards mobilizing community safety efforts. Through this group, actually, in 28, it was just last year, we actually were able to put forward a proposal to the federal government's National Crime Prevention Strategy about a study in which we look at the issue of missing youth. We're recognizing that a lot of our costs, especially when it comes to policing, it relates to that factor. We thought it was important to go ahead on that. So actually I worked with the OPP as well as some of the other groups as part of the Substance Abuse and Mental Health Task Force on putting together that proposal. Unfortunately, we were unsuccessful. However, I think that was a great example of our ability to mobilize all the different groups in Kenora to actually to create a proposal to actually do something that would make a huge difference. Also through the CMNCP, we've engaged a consultant, Felix Munger, through that network to actually look at redeveloping our community safety wellbeing plan. So that's going to be an important initiative coming down the line in the fall. And I'll get into a little bit more detail on what that is later on. And here's just a little bit of a picture on municipalities are all part of the CMNCP network. So it's important to note that this is a network of almost 40% of the population of Canada is represented under this network. So we're not alone in these issues related to crime prevention and these issues related to substance abuse. These are issues that are coast to coast. And I know Bob Burney and I, PP, often do our best to do a teleconference every month with CMNCP and try to learn from the municipalities what they're doing. I'm also just trying to understand what the different issues are as they pertain to community safety. Some other initiatives too that we pursued. So in April 2019, we worked with the KDSD on approving their application as it relates to rezoning of an area around 9th Street for the purpose of a supportive housing complex. I think as a municipality, we're really excited about the prospect of this facility. I know that from Henry's video there, certainly I think the results speak for itself, that I think we can replicate the success that Sioux have had here in Kenora. And then in May 2019, we've also initiated our own amendments to the official plan and the zoning bylaw. And that's through the allowance of public agencies to develop affordable housing in most designations and zones. So what this does is actually it streamlines on the approval process. So we already know that's very challenging in a northern context, and it reduces the risk of appeals. It reduces the risk of us losing a project given the shortened construction season. I also want to talk about the Municipal Capital Facilities Bylaw. So this bylaw we put in, our council approved last month, and it really is designed around 3 objectives. The first being is that we need a new definition of what affordable housing is. So looking at and tying it to the provincial policy statement being in its definition of low to moderate income earners, we've been able to create something that, or a definition that is, I think, realistic, that is, it applies to a variety of different income groups, and as well as it also provides a framework for which council can approve development support for different housing projects. So this development support could be extending municipal servicing. It could also mean tax incentives, so to support the operating cost of a potential affordable housing project. The last piece here is to incentivize both the public and private market, or private or proponents in terms of investing in affordable housing. And key here is bridging in the private market. Public government or governments of all levels are not investing in social housing or affordable housing the way they used to. So this is really important to actually bridge in the private market to kind of fill those gaps, and especially the gaps here in Kenora, which is across the spectrum. So now what? What are we doing in terms of action planning? Well, in the fall we will be proceeding along in redeveloping community safety wellbeing plan. So it will be built on largely the work that has already been done by the Substance Abuse and Mental Health Task Force. We already have a great plan. The problem is that it's been in effect since 2015, and we know that our risk environment has changed since then. I think the KSD as well as the OPP has shown the data that suggests the risks have changed significantly in the last couple of years. But here is just a graph of, or I guess an illustration of what the community safety wellbeing model is like. At the center in the bullseye there is your traditional policing model. So being very reactionary, kind of your traditional sense of responding to incidents. And as you go further outside the model there, you see that you have risk intervention, looking at prevention, and then social development. So especially that social development piece, the city has a large role in. So looking at putting in place housing, we're talking about food security, educational attainment, all these things go a long way in terms of making sure that vulnerable persons don't become vulnerable to begin with. So community safety well-being plans are based upon the identification of factors, risk factors in the community. So as I mentioned before, since 2015, these risks have changed. But what's going to be fundamental to actually that risk assessment is not just data and evidence, but it's public perception. We know the community, we need to get on side, we need to have buy-in in terms of this plan if it's ever going to be successful, and if it's ever going to be something that the community can get behind. And I think this forum and the one in the evening are great starts. We had a business information session, which is also a part of the whole community safety well-being plan process. And I think what we hear today, and also some of the comments that we heard in advance, is all going to be fed into that redevelopment process. And just in terms of the fall workshop, this is not an exhaustive list of different agencies that will be involved in the redevelopment of the plan, but certainly just showcases how broad that the network of service agencies are as it relates to community safety and well-being. This is certainly, if we're going to address the issues in the community, it doesn't just take policing, it takes healthcare, it takes social services, it takes the municipality, and it takes schools. And I just wanted to show this little chart. I don't know if it's kind of easy to see, but if you're looking at a best practice when it comes to reducing crime, because often we resign ourselves to the issues being so complex, so difficult to overcome. We kind of forget that there are models to follow when it comes to making dramatic differences or transformational change. So Glasgow is one example, where in 3 years they managed to reduce crime by 50%. And this is a checklist, and they abided by 7 internationally accepted standards in which you reduce crime. And I think in Kenora, we almost have all these factors. I think there's not too many of them which I'd say, you know what, we don't have that in place. I think the two that perhaps are missing or that we need to work on is the adequate sustained funding, and the other piece is also public engagement. So these are two variables that I think we need to work on in the future. All right, cool. We'll be working on in the present. Yeah, I think they're telling me to leave. All right, so I guess I will, as this slowly drops, just talk about that adequate sustained funding piece. So I think really how we drive change in that is advocacy. So working with our local partners, being the OBP, the KDSB, and other agencies to go forward to talk to the provincial and federal governments about what our needs are. So I know through the All Nations Health Partners, for example, they're looking at long-term treatment options in the city, looking at more resources dedicated to getting mobilized support on the streets and going to where vulnerable persons are actually located. And what I indicated here is just a number of the groups in which we're involved in, and where possible, we take a regional approach to these issues because we're not really alone. As I indicated earlier, this is a coast-to-coast issue in terms of crime, substance abuse, and mental health. So these are just a few of the different organizations which we're involved in, and I know in a few weeks we will be, as part of a city delegation, head to Ottawa to talk about many of the issues that we're seeing here today with provincial ministers. So that's something that we'll be doing very shortly. And then I'd just like to end off on a positive note, because like I said, that sometimes we get so embedded in the negativity, but I think sometimes we forget how successful we have been as a community. I think it starts with our downtown. I think if you look at our downtown revitalization efforts, with our government partners being the province and the feds, we've invested about $30 million in our downtown. And that includes from phases 1 all the way to 4, which is the current phase, and I know which is creating a lot of headaches from a traffic perspective. But also you look at wayfinding. So over $500,000 dedicated to those kiosks and signs that you see around the Harbour Town Centre, really driving visitors as well as locals to the attractions within our communities, those amenities that really make people want to come to Kenora. And then finally the Muse. So you can't forget about the $4.5 million Art Center, which is something it's a one-of-a-kind facility for the region. I mean, these are all exciting things that I think that many communities are, I don't want to say jealous of, but very many might be for Kenora's case. And then finally, I'd just say that we build on our community. So we build on our community in the sense that it's not just our downtown in which we have so many assets. Look around in terms of our community improvement planning process. So our community improvement plans in Keewatin, the Mill site, and Harbour Town Center, we've invested almost $900,000 dedicated towards these programs, and that's been leveraging $2.1 million from the private sector, and that's from 2007. In 2019, it's been a banner year. We're already business investment and coupled with our financial support has been phenomenal. So that's something definitely to highlight, but also looking at enhancing our public spaces. So if you look at Garrow and you look at Norland Park, between the private and public investment that has been dedicated towards those parks, I mean, it's quite phenomenal, and that they are now facilities or park spaces in which a lot of people, whether you're seasonal or local, you want to go to. And I think it speaks to a lot of the demographics that we really want to ensure stay in Kenora, that being the seniors, and you look at youth as well. So, and I think the splash pad as well as the new pickleball court are great examples of that. And yeah, I just wanted to finish off my presentation just kind of highlighting some of these different great projects that we do have on the go, and that to really that we should not be so resigned to fear and really look to perpetuate it, but really look at the solutions, look what we have, and really get behind our assets. Thank you, and I think I'll give the mic back to Mayor Dan.
All right, so thanks to all our presenters for their insight into the drivers affecting community safety, the constraints facing service providers, and for identifying pathways forward. We'll now move to the question and answer portion of the event. And I will ask those with any questions begin in orderly. We're going to line up behind, we'll have a mic here and a mic over there, and I'll go back and forth. When you do come up to ask your question, I would ask that you state your name, which member of our panel you're directing your question to, and then you can bring forth the question. Again, I remind you that the main purpose of this meeting today was to provide information to the community about the challenges facing and where opportunities exist for change coming present. So if we veer off from that, I'm going to reserve the right to just, your question won't be answered. I'll ask you to, we're going to look for questions directly towards our panel so that you can gain more information and insight into possible changes, suggestions, or where we can go in the future. So I hope everybody will respect that. So thank you very much. So whoever would like to come up first, please feel free. All right. Yeah, just your name, who you're going to address it to, Ryan, and then what your question or comment is.
Yeah. Can you guys hear me? Everybody can hear me? Hi, my name's Ryan. I've lived in Kenora for 17 years. It's more like I've got a comment and I've got a question directed to you. Because as I see it, the buck stops with you. You're the mayor. The city staff fall under your purview. Last couple of I don't know, 6 to 8 months, I've seen some absolutely disgusting comments by people in Kenora towards people with addictions, and I've done some I'm just angry. I've done some research on my own, and nobody becomes an addict because it's the weekend. Mostly it's from escaping family violence, or people have been raped, or people have come out of the residential school system. And some of the comments I've seen from people in Kenora has made me absolutely disgusted and ashamed to be a Canadian. When people need help, you help them. You don't treat them like they're lepers and then shove them out of the way or make them feel unwelcome. That's not the way Canadians are supposed to do things. We have a problem which I see only four options. We can follow the example of the Philippines and have state-sanctioned executions. We don't do that here in Canada. We can follow the example of the Russians, throw due process out to the wind, and jail them just for being addicts. We can get you guys to tax us more, to have Jeff and his officers arrest them more and spend more time on the streets, or we can help them. Helping them is the easiest and the cheapest way of doing things. And I pick up about 4 to 5 needles in my backyard every day. Like, I live right opposite the beer store. It seems to be like a thoroughfare for people to go to the beer store and stuff. I pick up maybe 3 or 4 yellow containers full every month overall. Yes, I've got a gash on my hand. I got stuck by a needle yesterday, and I knew it was a risk, and I'm going to do it again tomorrow. The problem with this gash is there used to be a green spot right opposite the health unit, across, like from me to that sign, across from the health unit. And you, when I say you, I mean the city, someone in all their infinite wisdom decided to take a spot where the addicts were congregating. It was out of the way, nobody lived there, tourists don't go there, children rarely walk through
I'm
there.
going to ask you to bring your question forward.
Yeah, is why you allowed the city to put rocks over an area that now has made us less safe, because those addicts that are up there now are in the downtown dropping their needles more. I got the needle from a guy who used to hang up in that green space, and I want to know why you allowed that to happen.
There's a fine balance between helping people and protecting people that live in the area. And we had people that lived on First Street North. In their minds, they were prisoners in their own homes. They reached out to the city for help. And that was the decision, that was the recommendation that came forward. And as a council, we supported the recommendation. Recognizing that no matter what we do, every decision we make, there'll always be somebody that questions the direction we choose to go. Yes, it was an area where people went, but it was not an area that left the people in that neighborhood feel safe. So our decision was, it is what it is, and we decided that was the way we're going. And I'm not going to stand up here. I'm the moderator. Questions directed to the city. I'll give you my card, and we can certainly have that discussion. But that was the decision, and we abide by that decision.
One last thing. When you guys made that decision to cover that area of rocks, did anybody at all think what's going to happen when you do that? Because now we have more needles downtown. We have more people in danger. You went from a bad situation to a really bad situation, and you actually made it worse. It seems to me like nobody actually took the time to think of the consequences of that particular action. Like, it's worse.
Ryan, despite what some people think, we just don't make decisions without thinking things through. We recognize that every time we make a decision, there could be negative impacts somewhere else. But that was the decision we made at the time, and as the mayor and as a member of the council team, I support the decision. So we'll live with that, and time will tell whether what you believe to be true or what we believe is. So we're going to move forward to, does anybody else have any question?
I have one. Hi, I'm Teresa Gala.
Tracy, you have to.
Yeah, sorry. I just want to ask Mr. Wall, before we had a crisis in not being able to get enough employees, we used to work well with Ontario Works. It doesn't work that way anymore. We used to hire a lot of our staff that we needed. Now, some of your staff say, you don't want to hire any of our people. We have no one. How can we change that? We're willing to work with these people and train them. And I do. I have some that are excellent workers, but it seems like they're hounded. I mean, my pay staff, like, please, let them work and collect and get further ahead. They need to buy cars because there's no transit on Sundays. And we need to work more to get more people to work. But the ones that are working poor, leave them alone. If, like, I don't know, it's hard. I need my pay stub because they lose it. And oh, I can't work so much because I'm going to lose money. No, please don't do that.
Please connect with me afterwards. I can tell you the only way out of poverty is a job that people feel proud of to have, and so we should connect. And in part, this is why we've been working with the Ministry of Children and Community Social Services for a couple of years now to say we need to simplify the process. That we've created a system that wants to hold account the 1%ers or like a small group that may use the system for that sake. And so I can tell you that the ministry has listened, and they're doing a full review with modernizing how Ontario works, making it easier just for those reasons, so that our caseworkers can actually focus on helping rather than on the administrative piece. And so that's something that this government is taking very seriously, and us as well. And absolutely, we need to get people to work. And surviving on social assistance is not a life. It's just surviving. And also why, when I mentioned with the housing we're building, as part of the contracts that we'll be awarding, is it's a requirement to hire people in social assistance. That's where we're going to also build skills as well. And so we should connect, because absolutely, I think any willing employer will do what we need to do to support people behind the scenes so that they can get a job. So thank you for that.
I forgot, like with the Bed and Vale, before we used to hire a lot, but they couldn't work past 10 o'clock at night. Well, if you are, your restaurant's open until 11, your dishwasher just has to leave you at 10. We can't, it doesn't work. So, and weekends, we need people. So if they have to answer to a probation officer or something, that person needs to be there 7 days a week.
And that was the whole intent of this new program,
Okay.
the supportive housing, is that we need to actually not set people up to fail.
Good.
With having curfews that may not work, but actually setting it so that their basic needs are met, that we respect justice, but we get them back on their feet so that they're not back in the justice system again. So very, very good point. And I can tell you that ourselves and in partnership with Canard Chiefs Advisory and the Nietzsche Friendship Center and the Justice System, the Attorney General's Office, that's what we're looking at. We're looking at having a system that works, and it's not just based on keeping people back and setting up to fail. So very good point. Thank you for that.
My name is Susan Evenden. I came to Kenora a long time ago as part of a police family. I've worked I've taught every kid for over a decade, so I know every kid that went through a long phase. I worked in psychology, dealing with, I was in support services, PTSD survivors from the residential school system. I do harm reduction with the health unit. I also am the operator of Anishinaabe Park. So by day I hand out needles, by night, last night at midnight, I'm dealing with one of our clients who's disruptive in the park. But people don't become meth addicts and then become homeless. They're homeless and they turn to something to make homes better. And I've got an article that I'm going to give you guys, the London Free Press. Homelessness comes first, crystal meth addiction comes afterwards. And I was going to talk to you guys, but really I've lived in this town a long time and I think I need to talk to you people because I know these kids, I've taught them, I've seen them since they were 4 years old, and now I'm handing them needles, and I've watched the process their whole lives. And they came from backgrounds, some of them you could have predicted, some you couldn't, and it's just so tragic. But There are solutions. I don't think Kenora, honestly, has truly invested in some, I see creative thought processes, but I've got, for years now, San Diego, Washington, Ottawa, Edmonton, tiny home villages, they violate our standards of how big a bedroom has to be, what zoning bylaws are, but they're the solution to so many people, for housing. People who are homeless tend to often have social skills that aren't great, they're hoarders, their friends crash on them, a tiny home meets their needs, and there are tiny home villages happening. I'm the Kenora lead, sorry I'm shaking here. I'm the Kenora lead for Wounded Warriors Canada, who deal with veterans who have PTSD, and there's a project happening in Edmonton and in Calgary where the homeless veterans are working to put together a tiny home village where the veterans who are homeless and not able to take care of themselves are supported by the veterans who are a little bit better off and can help them, and then support services are in that community. And they're living in tiny homes that are not standard housing that we think is important, but people can live, people just need a place. They just need some place where they can say, this is my home that I can be proud of. So I printed out all these articles on all the cities that are doing these tiny home villages, and obviously it's very similar to what's going on in Sioux Lookout, but we can't wait till the winter's coming, and these kids, and I'm old enough now that I can call anyone who's less than 40 a kid, so these kids need help. Winter's coming, Lila's Block is gone, and as horrible as it was, and I've been in there, and I cannot believe that we people in Kenora, myself included, have turned a blind eye to what these children are living in. And so we need to do better, and I know I've also worked in a mining camp where I lived in ATCO housing, and I know that ATCO, who was working with a lot of these tiny home villages to get structures up, they can come in, you can put together a structure quick, it doesn't have to be permanent, but these people need a place to sleep this winter, because otherwise they're going to be in our vestibules, they're going to be dying under our docks, and as people can, I don't want to have to deal with homeless people at Anishinaabe Park. I have a tourist operation I'm supposed to be running. But the bottom line is I don't want people dying, and I have to put aside my needs and what I want to see for the greater good of these kids. And literally, I'll close, because the other day I dealt with a man who, he was impaired. He was in the crystal meth addict. Crystal meth was last night. The impaired guy, he came, and I interacted with him on and off all day, so did the police, and we were all really good and kind to him, but by the end of the day I was fed up, I was mad, I'm a business owner in this aspect, and I'm mad at him, and I saw him the next morning, and I told him what he did, and he was ashamed of himself because he was sober the next morning, and I told him he could never come back. He cannot come back to Anishinaabe Park. This is a tourist place, this is not your place. And he laughed, and he looked so upset with himself because of the things he did, which were abhorrent. And 24 hours later, he was dead. He said to me while he was standing talking to me, this is my life, this is what I live, this is my life. And he's sobbing, and then he's happy, and then this is my life. 24 hours later, he didn't have a life. And I just think, what we are good people in this town. But sometimes we get scared, and we get selfish, and we forget that these people need help. This man was the same age as my oldest daughter.
Your question?
Thank you. You know, the person who spoke before me just helped us rip off it's Jan Coble, and I live in Kenora. You know, forums like this rip off the bandage, and it's painful, but it's educative, and that's what I'd like to thank you all for this morning. I learned a lot. I think a lot of us in this community live in fear and in ignorance, but the reality is here. It's not just here. We have to keep telling ourselves that, but you know, I think you captured, you know, the situation has captured us all, and there will be solutions. I just hope that we can all keep level heads and open hearts to get our community through this. And I thank the person from Nietzsche for being here, because I think it's only when we include First Nations people and First Nations communities, and sadly, there are very few First Nations people here. That's an issue we have to address, how to get everyone involved. But I think it's a great beginning, and thank you for doing this to everyone that's here. Thank you.
I'm Robert. I'm from Winnipeg. I moved out here 10 years ago. I am in recovery. I think we need to stop calling people addicts, for one thing. I think it's discriminatory and derogative. There's better terms for people that are struggling with addiction. And I think every city in Canada should have a safe injection site for these addicts to inject, so that the public is not in danger. They're going to inject anyway. And the stigma around addicts and alcoholics is, it's an 80-year-old terminology. We don't treat cancer the way we did 80 years ago, and we can't treat addiction the way we did 80 years ago. That's all I got to say.
Thank you.
Thank you, Robert. Just a quick note about the supervised consumption sites, which is what they're called now. They had been supervised injection sites. There's quite a few of them across Canada. There's quite a few of them in Ontario. Our previous provincial government also allowed us to open opioid overdose prevention sites as well in response to the people that were dying. Opening a supervised consumption site is not just something you can just do. The reason is because in that site you're allowing illegal activity. So you have to become an amendment to the Controlled Drugs and Substances Act. Jeff will correct me if I'm wrong. And so it's an application you have to do to the federal government. And there's a lot of steps involved. You have to do a lot of community consultations. You have to do a feasibility study. You have to make sure it's going to work in your community. So far, most of those sites are in larger centers. Thunder Bay has one now. Sudbury is just going through a feasibility study, and for some of these similar reasons, people are dying of opioid overdose, there's needles on the ground, and these sites have research, evidence has shown that they can improve some of those things. In-site, in downtown Eastside Vancouver, it's I think the longest one in Canada. But a lot of the research we have is from urban centers, where like in a 3-block radius, you have 2,000 people that are injecting drugs that use this site. It's a little different when we have a community like this. It's small population, we're very spread out. And I'm not sure how that would work here. I don't know. Honestly, I know these sites work, but there's a time and a place for them. So we've been talking at the health unit anyway about trying to do a feasibility study because the evidence should direct us, right? Because I honestly don't know if this would work here. So we're thinking about doing that, the feasibility study to look at, is there a need here? What would be the impact if we had one? Would people use it? A myth sometimes people think is that if we had a supervised consumption site, there would never be another needle on the ground. It's not mandatory that people use the consumption site. People would still be able to take needles, so it doesn't completely solve the problem. But evidence has shown they work. So we're looking at doing a feasibility study just to get a sense if this would work here. So I appreciate that it's definitely a controversial topic, but yeah, I appreciate you bringing it up. Thank you, Robert.
My name is Cheryl Kinney Matheson, and thank you very much for this opportunity to come together to learn. My question is addressed to Henry. And Henry, I would like to hear you elaborate on your strategy for the 45 days during which the shelter service hub will be closed. I'm presuming that this has to do with grounding and growing and improving the programming, but I'd like to know your plan and to the degree that you might be able to state something, your expected outcome.
Thank you for the question. It's one of the more difficult decisions that I've been part of in my professional life. Because on the surface it feels like it goes against every grain that I stand for and that we stand for as an organization. However, we do have a short window of opportunity in terms of the weather and so forth to really look at the program, the changes that have occurred in this community since the Service Hub opened. And I said earlier that our commitment is to make people thrive, not just survive. And so that went into that decision, looking and saying, we need to bring additional supports in to meet the needs that exist today, not losing focus on what the long-term solutions are, and there are some medium and long-term solutions for that. We need to make some structural changes inside the Service Hub to make sure that the programs and the operators can come in and do their work, that the service providers can do their job. We also have some missing operators, some missing partners, and so we're working with them now behind the scenes as well to make sure they can come in terms of some of the unique challenges that have been identified. We also want to make sure we have a 20-year lease with Knox United Church. We want to make sure that they too, that this meets their vision as well. So when we spoke, we had a vision to it, and it may seem counter to it. We want to make sure that they as a congregation also feel safe, that the residents, that the individuals staying at the shelter are safe and supported. And we have some of those safety things that need to be addressed. And so from that Service Hub, it was built for them. What we didn't do, what it wasn't designed to do, was to support other activity where people are looking to take advantage, who are brought people inside the shelter. That's what we're hearing. Elders who need that support are not staying there. They're finding other ways to stay in the community because they don't feel safe. And so from that, we have to go back to the drawing board and pretty darn quick. And so that's why when the announcement was made early this week, we have 2 weeks to put really emergency plans in place. We've called on our partners to help, and I can tell you that they're stepping up to help us through this, because what we don't want to see is where we're displacing 30 to 34 people just to the streets, because it's just going to make things worse. But that we have some temporary supports, and that we use the 45 days as an opportunity to make sure that we have something there that's going to work long term, that's going to work for the community, that's going to work for those who really need those supports. And so the decision wasn't made lightly. In working with Mr. Rickford's office, we spent all weekend going through this. It is difficult, and I feel heartbroken that we've had to do this. But I do know long term it is the right decision to do, and that we will be better for it as a community as well, and that we'll do a better job at supporting individuals. So from that, it is and winter's coming, and that's the other part too, is that we need to make sure that we use the next 40-some days as efficiently and effectively as possible to make sure we do a good job at supporting people who are on the streets, and that we also have a means of getting them off the streets. This isn't just about providing shelter to somebody 365 days of the week or days of the year. That we actually, through other programs, that the shelter should just be that short-term stay. It shouldn't be a long-term stay for folks. And also why the supportive housing piece is so important. And why Ontario has recognized that, and we have their full commitment. I can tell you, over the weekend, I am in contact with senior officials with every ministry that we work with who want to help, and we want to make sure that we have the resources, that when this restarts, that the appropriate resources are in place. And so it's challenging, but we have to get through this, and we will. And I can tell you that I don't care what it takes, we will get through this. And I'm asking for your trust and your support, because we will have something better at the end of it. So thank you for the question.
Hi, my name is Logan Haney, presumably white, but I'm actually Métis from Region 1, which shares lands with Treaty 3. I also sit on the Kenora Métis Council and a number of committees in Kenora. I had moved back to Kenora from Ottawa about 2 years ago to take on a job in criminal justice. So I got to learn a lot about Kenora in the past 2 years. I was in healthcare. And I guess a comment and maybe a critique about it and a question for you is that I've had to deal with government funding, so this is to Rickford as well, and Henry, because you say that you award funding. I've had 3 clients in the past year that I worked with very closely, got to know, and these were people that were marginalized, vulnerable, criminalized, and I got to know them very well. 3 men this year have died, 3 men that were made homeless, 2 of whom were living in those apartment buildings that had burned down. So to me, in 2 years of living here and working with clients and having 3 of them pass away, that's a huge problem, and a huge problem I found in working in my work. I'm a frontline worker, so I work with a lot of these individuals. And a big part of being a frontline worker is we get burnt out because we work incredibly hard. I sit on a number of committees where there's not usually a lot of frontline workers. And when you're making these decisions, have you canvassed the frontline workers? Have you canvassed the people that utilize the services? And there's sayings across the country for a lot of people, and it's especially substance users, nothing about us without us. Are you consulting these people that have to utilize sedative effects? And I understand that you have to make those decisions, that you hand down the funding, but are you supporting those programs? Because I have worked in those programs that have been funded by your services, and that have been affected by the government. When we switched from liberal to conservative, that change had a great effect on how I could deliver services, and it affected my clients. And those are the clients that end up homeless, that end up vulnerable in our community, that have addiction and mental health issues. And us frontline workers are doing our best to serve our community, and we do need your guys' help. We do need more people from our community to sit on these committees and to voice your concerns, to voice your fears, so that we can all work together, because I also live here. And I have a 3-year-old that I brought back to Kenora because I wanted him to be part of this community, to live with his family, and to live in a safe environment. And so I work every day doing that. So I want to know, are you going to support the services that you're funding? Not just saying it, but actually be at the table, speak to your frontline workers, speak to the people who utilize those services, and really engage with the community, not when it comes to forums, but every day and in this process for the 45 days. How's that going to work?
You're correct. The Kenora District Service funds a number of organizations across the region, whether it's the delivery of childcare, the delivery for housing services, or actually operating housing services. We ourselves employ over 200 employees who are involved in frontline work. And I can assure you that I may not sit at tables directly, but our staff are. And it is our goal to ensure that we help those who are most vulnerable in our communities. And I see my job as ensuring that our communities have the resources to do so. And so this is where I work very closely with our community leadership, whether it's with the mayor and council and senior administration at the city, for all of our municipalities, that we get the resources that we need so that our staff, that you can do the job as a frontline support worker, that the resources are here, and sometimes it takes time, and there are political shifts, and that's our reality. And but with that, I can tell you that just working with City Council here, we have a number of meetings coming up next month with a number of ministers that we're asking these questions, because Kenora does need support. And I do think from that standpoint, the message has been heard, and our job is to make sure that the resources come to this community so that we can actually support our most vulnerable.
Hi. My name is Louise Marston. I am the manager of the Ontario Disability Support Program here in Kenora. I work for the Ministry of Children, Community and Social Services. I'm also from Ottawa. And I moved up here 9 years ago to manage this program. And I'm up here I don't have a question, I have a comment, and I want to support all the people sitting in front of our community and putting forward some pretty important information that I think we as a community sometimes allow ourselves to sweep under the rug and move from the grass to the next plot of grass where it will be less seen. And obviously what we're at now is that everybody has seen and encountered individuals, actual people who are struggling. And we can't just keep moving them. They're here, they're part of our community too. And I sit at the risk table and I tell my staff it's the best and worst day of my week because we hear awful stories about individuals who are terribly struggling, and then I and 35 other agencies sit together and come up with a plan to support one person at a time, help one person move forward, and it's the best. But what I see as an ODSP manager is also frontline service workers really struggling to support clients who are struggling in a number of ways. And what I've seen and heard, and 9 times out of 10, the clients that get to me as the manager are people who don't have housing, people who are struggling to find a place to live, people who are not being discriminated against trying to find housing on $497 a month for a single individual on ODSP, and that's higher than Ontario Works, by the way. I have landlords calling me and saying ungodly things about our clients, which I know not to be true, assuming everyone on ODSP or Ontario Works is struggling with addiction, which is not true. There's hardworking people, a lot of them, trying to make ends meet in a system that's not always the be-all, end-all for them. And I'm here as the ministry, but I just really want to support all of the conversations that the city and PDSE and all the other partners are having around supportive housing and finding ways to help people have a roof over their heads, temporary or permanent, that will help them move forward, and that they're going to be able to go home to a place where they're not worried about their safety, they're not worried about their mail being stolen, they're not worried about their paycheck or any other check disappearing. I just really want to make sure that we all know that housing is the first step. I have a home, I have 3 children, I'm happy that I have a home, and I look around my community and I wish I could build a house for everyone. I was talking to a client the other day and calls me almost every day and tells me he doesn't have a place to live, and I have to tell him, I didn't build you a house last night. But we serve people out to Red Lake and Muir Falls and Sioux Lookout and almost out to Ignace, and it's the same problem everywhere. And Henry, you know it, you serve the same district as I do. But housing is, in my mind, professionally and personally, the key to the start of people being able to move forward and feeling like they can contribute to the community that they are a part of.
Hi, my name is Nikki Douglas, and in my past life, before I got so old, as my grandson pointed out, I was a public health nurse. So I think you've presented your case as well, and you've told us about the unfortunates that are in crisis in this town. What we haven't addressed is the crisis of businesses going out of business on Main Street. And unless there's a Main Street that's viable, there'll be no there's no tax base. So I'm just wondering what it's a short-term crisis right now, but it seems to be a crisis. And there's not people downtown. There's not people spending money. And I'm just wondering what you're going to do to help the taxpayer to keep viable.
Thank you for the question, Mrs. Douglas. We seem to be getting mixed information. We have, I walk downtown every Sunday. I'm really curious to see who's open, who's down and around. And I've heard businesses, some are thriving. I've talked to businesses who have said, their sales are higher than they've ever been. We've heard other people say that, their sales are down this year. So it's certainly, obviously on Wednesdays, it's a different world where everything's thriving. The bottom line is, in order to support the businesses, what we're seeing, and somebody made the point, a lot of the individuals we're seeing on the street, especially around Knox Church, those people have been here for a while. Unfortunately, they were inside a place that nobody really should have been living in, but they're out of sight, out of mind. So those individuals, they've been here for a while. So in order to make the perception or to make people feel safe, and we need to address the issues that the panel has discussed today. I believe every member on council, when we ran last fall, we all recognized that housing was the most important issue in order to address the shortcomings of the community. And that goes from social housing, supportive housing, right up to, how do we retain seniors within our community, because they need better housing options. So we recognize what's happening, and that's why we do it as a group. We've always maintained it's not a city issue, it's not a policing issue, it's not social, Henry's group's issue, it's all of our issue. And that's why we're working collectively as a group to try and move forward and move in positive directions. And that's why it's important for people today that, there's a lot of misinformation out there. And it's important for people to have the right information. We're never going to be 100% support of each other, but we have to work collectively in order to move progressively and make those positive changes for our community.
Hey everybody, my name is Andrew, and I actually work at the shelter, and I think it's important for my opinion and my fellow staff to voice our opinions, because we've been advised to withhold our opinions on social media and henceforth, just because we don't want any type of misunderstanding to be misconstrued to you guys. I think it would not be fair. But on behalf of the staff I work with, my main concern is we definitely don't want to abandon these people when we are closed for 45 days. And I understand the reasons for wanting to do that, because we do need some restructural things to take place in order to improve the living circumstances there. But I would also like to emphasize that the living arrangements at the shelter aren't ideal, they're not perfect, we do our best, but we're not enabling them necessarily to use drugs. We're just trying to provide them with a safe place where they can feel comfortable and sober. And it may not be obviously like apparent to everybody, but in the 6 months that I've been working there, I've seen massive improvements, and it's something that the whole team that I work with, we're very passionate about. And I would just like to emphasize as well that don't believe everything that you hear in the news, because we are painted in a negative light, and I don't necessarily agree with the propaganda against us, but I also would like to stress that our doors are always open. Anyone can come to us and they can be given a tour or shown around or see what it's really like, because I really would like to disperse this idea of, these people are dangerous. There's no need to be fearful of them. They're normal people just like you and me. And so I just would like to address everybody in the room and just ask the question, when you're in the comfort of your own home and you're comfortable and you have a full belly, just keep in mind some people don't have those opportunities and they don't have the privileges that we do, which striving to better their lives. So I think everyone in this room would want for anybody else. It's just the most Canadian thing we can do. And all I ask is mainly a statement. It's not really asking a question, but just please be patient, understanding and compassionate. That's all I wanted to say. I feel like, just working at the shelter, everybody deserves to hear what we have to say, and I know I'm just speaking, I'm just one person speaking right now, but on behalf of everybody, just thank you for just being so patient throughout the process, because it is something that it doesn't happen overnight. 6 months it's taken just to see small minor improvements, but I can't show you, but there's been significant improvements here in the city, and it's a slow process. So that's all I had to say. So it's just thank you for hearing me out.
All right, at this point in time, I'd like to formally close the Community Safety Forum and thank everyone for attending. Clearly from the overwhelming response to this forum and to this evening's session, the issues discussed are of major importance to the community. And based on both the questions posed, not only here today, but especially the ones that received online, it was really interesting to read those. One thought that there would be a lot of negative comments. What it mostly was people like today asking they wanted more information. They wanted to understand, why can't you do this? Why can you do that? Where are we going? So those questions were posed in a very positive light, and I think that's important if we're going to move together. So again, these are realistic opportunities for change, and it's important that we resolve this as partnerships. Again, for those your friends or that wanted to be a part of this, couldn't, Adam, approximately when? 2 weeks? Sure. Okay. So in a short time period then, what was recorded today will be available on the Kenora City's website online. So thank you very much, everybody, for coming today.
We also educate kids. We talk in schools, don't touch, tell an adult. So Canadian Pediatric Society did a position statement on this. Children that are most likely to poke themselves with a needle are between 5 and 8 years old, most often boys. Go figure. Boys. And most of those needle sticks are kids that purposefully pick up a needle and then poke themselves with it because they play with it. So it's not very often that people are running in a playground and they happen to fall right where there is a needle. It's usually that they purposefully pick it up and they stab themselves. So we talk to kids about what to do if they find a needle. And we find this goes over really well in our schools, age appropriate, right? So we're not talking, okay, JKers, let's talk about heroin and that, right? That doesn't come up. We don't, it's age appropriate. This is a needle, it's sharp. Needles are important, they're good for you, right? If you're at a doctor's office, if the health unit, we can give you medication that way. If you ever find one on the ground or your friend is holding one or if it's a playground, it's dangerous. Do not touch it and tell an adult. Kids dig through a sandbox. We talk about other outdoor safety elements as well at the same time. Working on a couple new resources. Someone asked how we could help keep kids safe, so that's why I've thrown this in. We're working on a resource for parents that we're going to give out through schools on how to talk to your kids. If you're having a hard time figuring out how to do that, you can call us, we'll do it for you. Or we'll give you a resource just to give you some tips. Oh man, that was it. I didn't give my cell phone. I'll add it when I send out the slides. Jeff will not be there. But I'll put it on here, and I as well, anyone who has called me here or has shown up in my office, I will talk about this program anytime. I am proud of this program. I understand the concerns about it, but we're all very open, and we live here too. We live here too, and we want this to be a community that we all want to live in, and we all feel good to live in. So I will send out my cell phone number, and you can give me a shout anytime. And look forward to questions. So thank you.
Thank you, Julie. Our next presenters are Henry Wall, the CAO for the Kenora District Services Board, and Patty Fairfield, the Executive Director of the Nietzsche Friendship Center. Henry Wall is the Chief Administrative Officer of the Kenora District Service Board. In his role, Henry brings an innovative approach to the delivery of programs and services administered through the KDSB, such as Ontario Works, community housing, early years programming, and emergency medical services land ambulance. The KDSB serves approximately 65,000 individuals across 9 municipalities and a vast area of unincorporated territories. Henry believes that complex needs and challenges often call for comprehensive and integrated solutions in order to diversely support the district's individuals and families. Patty Fairfield was born and raised in Kenora. She has worked at the Friendship Center since 2002 and has been the Executive Director since 2013. She oversees 24 programs at the center that cover everything from justice, employment, training, education, health and social services. Through her employment, she sits on many committees. She sits as a volunteer member for both Sunset Area Victim Crisis Assistance, the Referral Service, and the Adult Learning Line. Welcome, Henry and Patty.
Thank you very much. I hope today's going to go well, or as best as it can. I certainly appreciate you taking the time to be here this morning, because we have some important topics to discuss as a community. It's going to take this entire community to face this, to address the challenge that we are seeing. And so I think this is good for us to come together as a community. And in times like this, opportunities do come up. And I'm quite confident that we are going to find solutions to address the challenge that we're facing today. A little about the KDSB. Can you hear me okay? I'm hearing myself twice, so it's a bit of an echo, so I apologize if I kind of veer off with it. But a little bit about the Kenora District Services Board. Our area of responsibility covers the geography just over 400,000 square kilometers. So it is a massive geography that we're responsible for. We don't deliver services directly in First Nation communities, although First Nation communities that have road access, we provide EMS support to land ambulance. and it's about 18 First Nation communities that we support through emergency medical services. But what we started as well is that we've entered into a number of unique partnerships, whether it's with Memorandum of Understanding, or our Chiefs Advisory, or Windigo First Nations Council, or even the Anishinaabe Nation, because we recognize that across the regions, to take all of our communities to address some of the challenges that we're facing, and it can't just be done in one community. It can't just be done in the city of Kenora. That this is going to be a massive geography approach, and it's going to require all communities working together. It's also important that I just want to share with you in terms of how does our governance work. And the Kenora District Service Board is comprised of 13 board members, 9 of which are elected from our 9 municipalities. And then we have 4 unincorporated territories that have members directly elected to our board. So our board and what we do is everything is driven by community leaders. I don't want to talk about money, but part of what we do need to talk about is that we need resources to be able to address what we're facing. It will require resources. And the reason I want to share this particular slide, and you'll have to have your Superman goggles on for those in the back to see this, so this will be made public. Our budget is about $56 million annually now, and about $18 million comes locally through our 9 municipalities and the unincorporated territories. So a significant amount of resources is levied to our communities. And with regards to early years in care, so we don't just do homelessness, and we've got quite a few questions that have come in from you and other members of the community saying, is this all KDSB does? It's just homelessness. In fact, no, it's just a small part. In fact, we were not involved in that until it is becoming a crisis across the district. And so that's why we are getting involved and why we're not afraid to roll up our sleeves, maybe making a mistake, but certainly not backing away from the challenge to addressing a serious crisis, which is homelessness. If you're accessing licensed childcare, there's a very, very good chance that space that you're accessing, that your child is accessing, has support from the KDSB to subsidize those rates. Because without funding, without that subsidization, the rates that families are paying today, which can be ranged between $40 and $50, $60, would be a heck of a lot higher than that. And so we spend a great deal in supporting early years. And also why we've been looking at the last year or so to actually add more childcare spaces as well. And so we implemented a plan last year in partnership with many organizations that we support to actually develop 150 new childcare spaces. A lot of them in this community, because we need more. That's something that families are asking for us. In order to attain work, to attain housing, families need access to affordable childcare. And so, but that's not something we talk too much about. In particular this community, it's been homelessness and poverty. We also deliver Ontario Works, and this includes social assistance and a number of life skills supports, development, and also pre-employment support services. And the asset management, this is housing. Under our portfolio, we have now close to 1,300 housing units that are under our portfolio, and we do fund organizations such as Kenora Nonprofit Housing Corporation. We fund them to the tune of about $1.3 million a year, so that those rents can be affordable for seniors and for families living in those housing units. And then the last part is EMS, line ambulance. And why I want to show this slide, why it's so important, is that when we respond to community challenges with lights and sirens, resources have to be diverted from somewhere else. And so if we look at, even at our 2016 actuals locally, what we levy our municipalities, what we levy the city of Kenora, which if you're a property taxpayer, you're paying towards that. We spent about $7.7 million for EMS across the region. We fast forward to 2019, we're just under $10 million. 2016 was the first year in which we were investing more resources in EMS than we were in housing. We're spending more money in lights and sirens than we are on prevention. And that's an issue. So that's why this slide is so important, is that we have to look at addressing things differently here. And at lights and sirens, we have some incredible staff, whether it's OPP or our paramedic services. They're well-trained, dedicated. But I can tell you in terms of if we want to get ahead of the call volume increase, we have to start investing upstream. Health equity only exists when everyone in our society. Actually, I'll rephrase this. Health equity can only exist when everybody in our society has the same opportunity to reach their full potential. This is regardless of whether you are Indigenous or not, regardless of whether you have an income or not. This will only exist when we all have the same opportunities. And I can tell you that we do not at this point in time. And we see it from the stats, which is why in the next couple of slides I will be presenting quite a bit of stats. Because I believe that when we make program decisions and policy decisions, it has to be grounded not just in hearsay or opinion, but it has to be grounded in factual information. Youth in our region, in the district of Kenora, are 8 times more likely to commit suicide than anywhere else in this province. We have the 2nd highest child poverty rate in all the federal election districts in Ontario. And this is why the work that many of you are doing, whether it's with our Chiefs Advisory, with the Youth Wellness Hub, and the supports that all of you are giving to that, that's why those programs are so darn important. Because we have to start investing in our youth so that they don't become staff when they're older, when they reach 18 and they're aging out of care, or now they're left to fend for themselves. And also why the work that our school boards are doing is so incredibly important. Because I'm a big believer that for a lot of it, it was education that got us into this through the residential school legacy. But it's also going to be education that's going to get us out of this as well. When we look at families with children, we have the 7th highest percentage of low-income families with children in the entire country. And I can tell you what we're seeing. I have to make a confession. I'm not a social worker. I'm actually an economist. So there's a bit of an oxymoron in the fact that I do work for a social services agency. But the reason this is so important is that, in particular in this city, we have a significant growing gap between those who have resources and those who do not. And ironically, as more and more families are pushed to the edges of being able to afford their housing, being able to afford life, and it results in other issues arising, whether we need to now invest more in healthcare, we need to invest more in supports. What is happening is we bring in experts with salaries, and it just inherently pushes more and more families to that brink, because we don't have a housing stock that's keeping up with demand. And we see this not just in Kenora, but we're seeing this in other communities in the region as well. And coupled with this, we do have the fastest growing demographic population in Ontario. So what I'm going to talk to you about as well, I mean, from the last census to 2016, our population was estimated to have grown just under 14%. This is a bit false in that when we talk about population or census, some of it is, there's a lot of estimation, but not all of our communities participate in the census. So it skews it a bit. So it's likely this is even underreported. But it's the best we have, and this is where a lot of policy decisions, whether it be federal or provincial, are made based on these stats, which aren't always accurate. So I think we always have to be mindful of when we take some things as gospel as well. When we look at household increases or growth between, say, 2011 and 2020, so these are estimates, projections based on information that we have working with the Ministry of Municipal Affairs and Housing, that overall in that time period that we're estimating that our population from a household base have grown about 26%. But when you look at in terms of which household is growing the fastest, it's actually a lone parent family household. It's actually anticipated to grow at 45%. And we flip over to this side, so to the, which would be your right side. In terms of demographics and the number of children per household, the fastest is households with 3 or more children. We're anticipating that by 2020, that will increase by 59%. So we will have more lone parent households with more children. So this is why it's so important we look at what are we doing in early years to support families. And what are we doing to support mom and dad who are trying to raise kids on their own, who have 2, 3, 4 jobs. Do they have transportation that actually meets their needs? Or are they spending their entire day trying to go from job to job and other things are starting to fall? Or now are they losing their entire housing situation? And so we spend a lot of resources as well, not just with families, but also with seniors who own their home, who are on the edge of losing it all, to support them with that next mortgage payment or to support them with that next utility bill. So we need to pay attention, especially if we look at building more housing and we're looking at designing community programs, are we meeting the needs of our families, especially lone parent households? All that's small. The blue is the District of Kenora based on age, on the rates at which individuals represent at the hospital for mental and behavioral disorders. And as you can tell, between the ages of 15 and 24, we don't leave the province behind. We blow it right out of the freaking water. This is our future. And so if we don't do something, and roll our sleeves as a community, what is going to happen to our young people? I don't have the answers to that, but I certainly there's a lot of you in the room, which is why we have to be solution-based today. Because I think finger pointing will get us nowhere. In fact, I think we're going to go backwards. I also want to talk about EMS call volume. In Kenora, we've seen a steady increase in the number of 911 calls placed here in this. In 2014, we had just over 4,000 calls for 911 in this community. So community population 16,000, 4,000 calls. It's not normal. I can tell you that. Not by any shot in Ontario. We fast forward to 2018, we almost surpassed 5,400 calls. So quite a few questions that I got from you was, did the new service upgrade the increase in lights and sirens in the downtown? Well, I can tell you that the increases exist a long time before the shelter came along. A long time. But this is not sustainable either. When we look at, for example, our call volume, so the next couple of graphs that I'll talk about is looking at the city boundary. So the Kenora base, so the numbers I just gave you was for the calls that our Kenora resources here respond to, so they could be responding to other communities, to an incorporated area. This is simply in the kind of the town center. So we drew a line in our GPS system, and this is so based on this. And so what I want to tell you is that when we look at the center of Kenora, so Kenora as a city, our call volume has gone up 40% just from last year in the first 6 months. And it's not around the service hub. It is everywhere. So when we start dotting where these calls are coming from, it is coming from the entire community. So we don't necessarily have just a hotspot. It is, the city is a hotspot. It's one big blob of red, if you want to put it that way. With this next piece of information, called up a mentor of mine who's respect a lot, and I don't tell her this, but she's a chief of one of communities that we work closely with, and I said, I'm afraid to show this information because I don't want to come across as disrespectful. What do I do? And her response to me was, is it the truth? I said, yes, and so there's your answer. So there is a belief in the community that the challenges that we're seeing in downtown, that is just an Indigenous issue. That what we're seeing in regards to the increase in EMS calls, that it's Indigenous people driving that, and I can tell you, when we run the numbers, it is not true. So this graph shows by age the call volume in the city, and when you start looking at from 0 to 61, it is even, just about. And I can tell you that our population is about even, Indigenous versus non-Indigenous. So what we're facing is not an Indigenous issue. This is a community issue. And I can tell you that individuals that struggle aren't just homeless people, that there are individuals that I know of you in the audience who have family members, you have resources, you have access to resources who are part of these stats. So this is a community issue. But one thing that we do need to pay attention to, when you look at that red, so that red is first the patients that are identified as First Nation. Do you see that drop after 51 years old? That should be a concern, and why we need to be working as hard as we can, and which is why the All Nations Health Partners in this community is working incredibly hard, has been incredibly successful to look at, is this a healthcare issue, or are elders dying prematurely? And it's both. One is, there's a lot of white in the audience. Let's just address the elephant in the room. There's a lot of fear in terms of what's happening in our community. When we surveyed families in terms of what programs are needed, what we found, in particular with the early years, when we looked at the early on centers coming over to the KDSB, this was last year, we wanted to know what were the needs of families. And what we found through the results that families provided to us, we had a great response rate from the non-Indigenous community, and next to zero response rate from the Indigenous community. And so we went back, we wanted to hear from Indigenous families, what do they need in our communities to not just survive, but to thrive, and this is their community too. And what we heard too is that they do not feel that programs they access, that they can trust the programs, that they don't feel welcome in the programs. So we have the same feeling and fear on the other side. So I think that's another piece I want to leave with you as a community is how do we ensure that every member in our community feels comfortable and accepted in everything that we do, whether it's accessing programs and services. And it was through that we're investing in developing 2 brand new Indigenous childcare centers in this community, as well as an Indigenous early on center, because our Indigenous families need to feel safe and accepted as well. But part of that too is that why are elders not presenting in the hospital? Do they feel comfortable or not? Or are they just dying prematurely? Either way, it's something that we need to fix. When it comes to alcohol intoxication, our call rate in the city of Kenora has increased by over 300% over last year, the first 6 months. I can tell you that it's not the shelter that's created this. We've had some occurrences, whether the fires that occurred, we're losing more housing than we're gaining, and families are struggling to meet ends meet more and more than they have ever before. And so people are turning to other things. And substance is one of those things. It's available, it's cheap, but it's terrible. The other piece I want to talk to you about as well is behavior and psychiatric calls. And it's doubled from last year in the first 6 months. So I can tell you that our paramedics have an incredibly tough job. And so when you see a paramedic, and there's a few in the room here, give them a pat on the back. It is not easy. And this is in part why we have to work really hard as a community to ensure that whether it's a paramedic, whether it's a police officer, they're not social workers. That's not the skills we gave them. But that's what, because of the gaps that we have in programs and services, that's what they're starting to do. We also look at in terms of, Inspector Jeff had mentioned this, we have a core group of individuals. So this is the other piece I'm going to share with you, that helping people is good business. So in the last 6 months, we've had 18 individuals who have presented in the ER more than 331 times, and they arrived there in the back of an ambulance. I can tell you that this will pay for housing for all 18 for an entire year. So as a community, how are we choosing to pay for this? Lights and sirens, or we're going to actually invest in housing with support? And Kenora, you're not the only community facing these. Dryden and Lookout are in the same boat. You start looking on a population base. So there is merit, and it would be an opportunity missed if communities don't start working together across the region to address this. The next slide, this is just what our 911 call volume has done for the last, well, over 20 years. You can just see that it looks like there's a jet taken off. It's not sustainable. And so this is where I think as a community we've come to a breaking point, and you feel it. I can feel the energy. And so there's a lot of bright minds here. And I know that we can come up with solutions so that these trends start to go down, so that I don't have to take resources from housing and put it into EMS. And let's talk about housing for a bit. At the end of last year, we had almost 1,100 families waiting for housing on our housing wait list. So, and you have to qualify based on an income. So this doesn't even address families who have resources, who want to come here for work, for a job, who just can't find a place to live. So this is simply those who qualify because of their income level. And when we look at the city of Kenora, we have 515. So almost half of our wait list is here in the city of Kenora. So just to address their wait list for housing, KDSB needs to build over 500 housing units just to address the wait list. In regards to seniors, we had 108 seniors we need affordable housing, because they cannot afford their current situation. So I can tell you that I've been meeting with City Council on a regular basis because we are going to build new seniors housing in this community. And it's not going to be 2 years from now, it's going to be next year. I can promise you that. But we're also going to build a whole lot of other housing as well. And things are in the works for just that. It's just taken a long time to get the resources, to get the partners lined up, to get the energy moving. Because infrastructure doesn't just pop out of the ground with no effort. It takes a lot of planning. Quite a few questions that came in too is that, and I got questions saying, one of the statements that I got too was that I've single-handedly have destroyed Kenora because there wasn't a homeless population here until the shelter came along. It may be well hidden. So last year, May, when we did our homeless enumeration study, we had found that we had over 393 individuals in our 9 municipalities who identified as homeless, true homeless, not precariously housed, but homeless. Over 200 of those individuals were here in the city, doing all sorts of things to try to keep a couch, whether sleeping in a boat. So that's what we need to help. And that was the whole intent and the purpose of the service hub. So it seems incredibly stupid that we've closed it, but we're going to get into that, why that's necessary, because we're committed to not just getting people to survive, but actually thrive in this community. That's the goal. I think for too long we've had people survive on the streets, and that's not good enough. It's not good enough to give somebody who's 18 years old an extra 10 years of their life. They should be reaching 80, not 28. And so that's why we're making some of the decisions, and also why we're going to ask you to trust us, and why we also need to rely on all of you to help with this as well. What I do want to share as well is that when we did the study, we found almost 18% of the individuals too were actually at that time housed in the Kenora jail. So we're estimating that Ontario spent last year about $5.6 million housing homeless people in jail. This is why the city and First Nations communities, and why we have the province of Ontario working really hard to look at how justice and how the justice system works in Kenora, and why investments are coming to this community. Because everybody recognizes that this is not the right way to house people. And if we're going to cycle people in and out of the jail, we're not helping them, we're just making things worse. The other piece I want to share with you, in terms of what we looked at, our 2017 911 calls across the region, what we found, so this is psychiatric, emotional, and behavioral distress calls. On the far side, you have ages 5 to 10, so it goes up in 5-year increments. And what you see on the other side is that our youth are in crisis. The blue is females, the orange is male. Our young girls are in crisis, which is why if you're involved in youth programming, you cannot give up. You need to work harder. I'm not telling you what to do, but it just, because what's going to happen is this trend is going to push forward if we don't do something. And it's not right that we have 11 to 15-year-olds leading the charge in terms of being the most represented demographics in the back of an ambulance showing up the ER, because they cannot cope with their situation in life. So, a good friend of mine, Sean Monteith, who I'm quite mad is leaving, quoted quite well, is that we will be successful where we have equity and hope for all of our people, all of our residents, all of our youth. And so are we giving our young people hope that tomorrow for them is going to be better? And I can tell you there's a direct correlation between that stat and the fact that our youth 8 times more likely to commit suicide. So what is the response? So I give you a lot of doom and gloom, but there's also solutions. And there's a lot of effort and work that's gone on behind the scenes to start fixing things, to start curbing the trend. Supportive housing. So there's 20 units being planned. That will be, we're working with the city now to get water and sewer extended to this property. This project will be operational in the next 15 months. It's aggressive, but it's going to happen. What we've heard is this is 20 units, and what we've heard is that we need more And in fact, we're taking that and we're going to see financially, if we cannot do it, so this can actually be a 30-unit supportive housing development. Because this stuff works. Supporting people, meeting them where they're at, is not enabling. In fact, it is actually giving them a chance in life. And so if I could, and hopefully this works, I want to show you a video that we did of the project we did in Suluka. We've tested this. It's been operational for almost a year. It'll be a year next month. It works. And there's people in this program who the community wrote off. And you know what? They're actually now enrolled in an educational program. They're getting their literacy skills up, and some are actually even employed. So it's a demonstration to me that it doesn't matter how bad the addiction, if there's love and compassion and support, people will change.
What is home?
What is home? Where you choose it to be. Home is where you're safe. Home is where you have support.
Home, where you're safe, you feel loved, and you're appreciated.
You can just relax and breathe and just have your own time, your own space. Knowing that you're going to be okay, being able to reach out to other people.
Home is where you choose that to be, and they've never had that option to call a place a home. Our tenants have never had that opportunity, a lot of them.
What is home to you?
Stability.
Having a home is probably one of the most important things in a person's life.
It's necessities, but some people just take it for granted, because it's always been there.
It's something that everybody deserves, and not everybody has.
Suluka's had a negative housing situation since I came to Suluka in 1975 or 76.
The issue of homelessness, the issues of addictions, and the issues of mental health. That is the largest percentage that we deal with on a daily basis.
All communities have these issues. We continue doing the same thing over and over.
People may not understand, when we choose to be homeless. It's very difficult to get a job when you sleep in a derelict car at night. It's very difficult to get a job when you don't have a watch. You can't work on anything here. The trauma, the addictions.
The housing first model, that's really what needs to be in place first and foremost before we can address any further concerns.
The supportive housing unit here in Suluka opened on the 15th of August 2018.
There are 20 units, a wing on each side with the kind of hub and the kitchen in the middle. Supportive housing gives that basic need to every individual, any individual that needs that roof over their head. Safe and affordable housing with supports. Bringing in the supports on site to ensure that people can move forward in whatever that means for them.
At the end of the day, this money is taxpayers' money, and it's much more efficient to provide someone with housing than to leave them on the street and having them dealt with in a reactive manner. There's safety, there's companionship, there's friendships. It feels like a big family. It's a relief to have. It's a blessing.
We're providing people with a new start.
Giving them a chance to have a better life is really what it's about.
You're only as strong as your most vulnerable in your community.
I don't think I've ever seen the agencies in Suluka work together as much as they have.
Basically, anything specific to a tenant's needs, supports will come in.
We have already seen great successes with people, getting away from addictions and becoming functioning members of society. Just having the security of knowing I can come to my home.
To see the smiles and the pride. It's an absolute pleasure and an honor to be a part of a project. Sorry, such as this.
If it works in Sioux Lookout, it'll work in Kenora. What I want to share with you too is in terms of, does it work, and we have data to support it. And so what I'm going to share with you in terms of, we looked at, respectfully, in terms of call volume for police for the 2010, 4 months before they came into the program, and we looked at 4 months after. And what we found is, not everybody was as successful, but generally tremendous amount of success. In fact, there was a 56% reduction in calls for police. So we look at over the year now that the municipality of Sioux Lookout will have 564 less calls for police services. So allowing the police to do other things which they're mandated to do, instead of looking after people who need help, who need housing. And what is translated to the municipality between $200,000 and $300,000 a year property tax savings. So that's equivalent to almost 10 households here in Kenora. So I did some, looked at this city's tax rate, and at your median assessment, this is 10 households in Kenora. So this is how we're also going to help the city save resources as well. We're working with stakeholders to develop a group home. This is 10 units. We need to support youth that are aging out of care. They're not criminals. They're in the system who are about to be on the streets, because that seems to be the trend, and this is to prevent that. Next month, our tender will close for construction for a 28-unit supportive housing program designed to support people who are trapped in the justice system. This will be built or started this year, and it'll be open a year from now. So we have 58 new units that are starting to construction this year. And it's thanks in large part to Ontario Minister Bickford, thank you, but also to a lot of you in the room who have worked tremendously hard in supporting these projects, whether it's through advocacy or giving your wisdom, your expertise, or actually coming to the table with resources as well. And so these programs aren't about duplicating other things, but actually bringing all of us together. So this is, it's hard to see, but this is in part what it's going to look like. We were able to partner with the Canadian Mental Health Association Kenora branch on a safe bed program in Kuwait. We look after the housing, they look after the program. It works. So instead of having individuals end up in the ER or in jail or at the shelter, this is a place where they have supports immediately. We have had some challenges that I can tell you, you as a community, or as a community, Kenora is the most difficult community to get housing built. And so I think we have a lot of conversations like this to have, to dispel fear around supportive housing, addictions, mental health, and why people are homeless. And I don't say that to say I'm wheeling a yardstick here. I'm just saying to other communities that we still have a lot of work to do to educate ourselves. And also to, I think, open up our hearts a bit more. Because fear does awful things to us as human beings. When we start dehumanizing other people, we close ourselves up and I think we do a huge disservice to the community. And Patty, I do want to talk about the closure of the shelter and why it's necessary. But before that, Patty, I'll hand it over to you to talk with the Chief Friendship Center. Thank you very much.
Good morning, everyone. I would just first like to acknowledge and recognize that we are in Treaty 3 territory. I also want to point out I had tinnitus, and because of that there's hearing loss, so sometimes I tend to yell, and I don't realize I'm doing that, but I'll be on the phone and my husband will be looking at me going, "Hun, your inside voice. So if I'm yelling, I apologize. It's not because I intend to do that. It's just that's the reason why. I also wanted to state that I wasn't originally on the panel. We had discussed this last week. Felt it was really important that the Friendship Center was here and that we were able to have an opportunity to speak. Just because so much of the comments that we've read and things that have been on the media have pointed to the Friendship Center, so we felt it was important to be here to talk to the community. So with that, I was on vacation last week, but did come in for some meetings and working on my notes yesterday to make sure that really I wanted to make sure that I covered everything that I felt was really important that I wanted to state, and also looking at the questions that people had sent in that to try to cover as many of those questions as I possibly could. So in my saying that to you, and the reason I'm telling you that is because when I write notes, what I tend to do is look at my notes. So I do apologize ahead of time. That's just one of my vices, and I'm sorry for doing that, but I really don't want to miss anything important that I wanted to say to all of you today. So I wanted to start off, first of all, by just giving you a little bit of background information about Friendship Centers. So the doors of the first Friendship Center opened in Canada in 1958, as Aboriginal people began moving from reserves to urban settings. As Aboriginal people relocated, they were faced with many problems in receiving services due to cultural differences, bureaucracy, and the barriers of language and systemic prejudice. Friendship Centers began in order to assist Aboriginal people with their adjustment and integration as they migrated into the urban environment. The Friendship Center movement is the country's most significant off-reserve Aboriginal service delivery infrastructure. For over half a century, Friendship Centers have helped urban Aboriginal people access the vital services they need to succeed in urban settings across Canada. Friendship Centers understand the challenges facing our communities, and their unique wraparound service delivery model ensures we are well equipped to tackle them. Across the country, Friendship Centers provide culturally appropriate services for Aboriginal people living in urban centers and have become a place for Aboriginal and non-Aboriginal people to come together, to share traditions and to learn from one another. The main objective for all Friendship Centers is to improve the quality of life for urban Aboriginal people. The main target groups of each Friendship Center are, of course, the urban Aboriginal population. However, we never turn anybody away. This includes all age groups. Friendship Centers act as support systems to the community by providing programs that provide essential services, which will assist them in contributing to the economy. These services are aimed at promoting the physical, emotional, spiritual, and cultural well-being of all Aboriginal people. Niji is the Ojibwe word for close friend or brother. The Niji Friendship Center was incorporated in May of 1976 and is managed by a board of directors, which is elected at the annual general meeting and served for a period of 3 years. The executive director, HR manager, the executive assistant, the finance officer, and receptionist comprise the core staff. The director is responsible to the board of directors, which consists of 6 members with diverse backgrounds. And the other staff are immediately responsible to the HR manager, excluding Vail residency workers and the Service Hub shelter workers who are responsible to the manager of these 2 programs. There are 118 Friendship Centers across Canada, and there are 29 in Ontario. Every Friendship Center is different in what they offer, and we are fortunate that we have actually 23 programs covering everything from health, justice, education, employment and training, and social services. We have programs from pre-birth to the elderly and for all abilities. So we have an Indigenous Healthy Babies program, an Aboriginal Family Support program, early on, the Oguego Children's Program, Indigenous Children's Wellness Program, Wassanaben Youth Program, Youth Life Promotion Program, Indigenous Healing and Wellness, the Apatuan Employment and Training, Alternative Secondary School Program, the Indigenous Community Justice, the Urban Aboriginal Healthy Living, Lifelong Care, our Service Hub Emergency Shelter. We have criminal court workers and family court workers that work directly out of the Kenora Courthouse. We have a drug education and living worker and a Native inmate liaison officer that work directly out of the Kenora Jail. We have a Kijay worker, which is I'm a Kind Man. We have a cultural resource. We have Vail Supervision Verification Program and the Vail Residency Program and our community-based sense of home research project. Our vision is to improve the quality of life for Aboriginal people living in an urban environment by supporting self-determined activities which encourage equal access to and participation in Canadian society and which respect Aboriginal cultural distinctiveness. As a Friendship Center, we work very hard to build partnerships wherever we can to ensure that our community members, clients' needs are met. Partnerships are key to building a community network of services that do not overlap and can be easily accessed. It is very important to myself and the Board of Directors that the Friendship Center staff have a seat at various committees in town. It is mandatory for all staff to sit on at least one committee that is relevant to their position. This not only is beneficial to our Friendship Center, but to the community as a whole, as it ensures that the people are aware of the vast amount of programs we offer and that referrals are made as needed. As a Friendship Center, we do not enable, we empower. We provide the knowledge, the skills, and tools that are needed so that individuals may become active participants in the economy. And for more information about the Friendship Center itself, you can visit our website. And we also have a Facebook page. All right, so to get into the service shelter hub, which I'm sure everybody is wanting to hear about, I do want to acknowledge and add that we have and continue to take concerns of the community very, very seriously. Towards addressing and resolving these concerns, we have been working with our partners on solutions towards mitigating the issues and challenges facing the shelter, its clientele, and the community as a whole. We meet bi-weekly with representatives of Knox Church, the OPP, the City of Kenora District Services Board, where we discuss concerns, issues, and solutions. As people are likely aware, when the work towards creating the shelter began in 2015, there was a very different clientele with different issues, needs, and requirements. Within the last 18 months, meth has come into our community in a very prevalent way, which plays a large factor in the issues and concerns expressed by the community. Many cities and towns within Canada are also struggling to address these same issues brought about by the use of the drug, and Kenora obviously is no different. The shelter cannot control the availability of the use of this drug, but only try to manage the outcomes of its use amongst Kenora's most vulnerable. Unfortunately, when planning for the shelter, none of the parties involved could foresee the drug's effects or outcomes of the shelter's clientele and the larger community. With that being said, I am certainly not making excuses, but making a point that the issues and concerns expressed by the community is a larger issue facing the Kenora community as a whole. Together, the shelter is but a symptom, not the cause of this larger issue. As a community, we can work towards providing services to those most vulnerable to address the addiction and mental health issues facing Kenora today. When we moved out of the health unit, the new space in Knox was still under construction. However, we had to make it work as we needed a space to provide overnight accommodations to ensure people were out of the cold. Things that were not foreseen have resulted in further barriers. For example, industrial washers breaking down, use of small residential machines being used in the program lounge area, and this is a continual ongoing thing throughout the day and evening, due to the high volume of towels, bedding, blankets, nightwear, and kitchen items. The TV was just connected prior to the July long weekend, and unfortunately have not been able to get cable installed as of yet. So what we've had is we were fortunate to have our staff who are willing to use their own personal Netflix accounts to have the TV up and running so patrons would have something to do inside. And not just that, I mean, we did go out, we purchased board games, we have cards, we have crib, trying to create something for people to do. Because we know that if people are bored, it's only going to create negative behaviors. The shelter has been working to the best of its ability with the resources that are currently available to operate and meet the needs of the clientele in a safe and effective manner. However, due to many factors, the shelter has not been able to provide all of the services we had intended as of present. The shelter is actively working on resolving these shortfalls in services, and it is hoped that the intended hub services will begin and will soon address the issues and concerns expressed. It is important to note that a meeting was scheduled with some of the service providers that we felt were the most in need right away. We were fortunate that WINAC's Executive Director, Anita Cameron, offered to assist us with this, and she offered up her employee, Lucille Michaud, who actually conducted and facilitated a meeting. However, during this meeting, several questions did come up from those that were at the meeting, things like safety, layout of the facility, and what kind of space was going to be provided. Due to the issues mentioned regarding not having the space completed, that would be the program room area, we have been unable to provide the programming as of yet. The tour of the facility did happen, and most of those that had been at the meeting did come and attend the tour. And just so you know, some of the agencies we did have at the table at that additional meeting were those that dealt with mental health, health, and addictions, along with law enforcement. And we do know that quite a few of our patrons do already have workers in the community. I would like to point out that we have provided some of our program services to the patrons, which have been in-house at the shelter, or at our main facility, or with our court workers at the courthouse. While we have not scheduled actual programming at the shelter due to not having the space at this time, it is important to note we have been open to other service providers coming in to meet with their clients. We have had the OPP stop by quite regularly, and that's not necessarily because they received a call for service, it's because they just stopped in to have coffee and chat with the staff and the patrons. We've also had Kenora Chiefs come by periodically to volunteer their time, and the health unit staff come by quite often. We have reached out to the Ontario Federation of Indigenous Friendship Centres in regards to the issues that we are facing around meth, and we are hoping to get information on how we as a friendship center can work with those addicted to this drug. And also, what tools can we start to acquire, or what can we get to look at prevention? Right now, it seems that we are constantly in crisis mode, and we really need to start looking at how we're going to prevent this, or things are only going to get worse. We have a higher volume of people coming for food that are not residing within the shelter, but the need is there. We serve anywhere from 50 to 70 people, including families. We have a cook and a shelter patron who volunteers his time in the kitchen to prepare all the meals. We have limited volunteers. However, it must be noted that the space in the kitchen is really not conducive and comfortable to take more than 3 people. To dispel some of the rumors we have heard, we do have rules at the shelter, and when they are not adhered to, there are repercussions. Depending on the severity, it can be a verbal warning, not warning, an eviction for a few hours, up to 24 hours, or an actual ban can be put in place, and that there is no specified time depending on what has occurred. It is explained to the individual why their behavior is unacceptable and the ways to improve. When someone is evicted or banned, we do not provide food or beverages to them during this time. We do not have a waiting list to get in. In fact, we have not been to full capacity in the last couple of months. We average anywhere from 32 to 34 per night. I would say that most are local who stay at the shelter, and honestly, I am not sure why anyone would want to come and stay just at our shelter, because we are not the Carlton Ritzes of shelters. Most communities do have shelters of their own, where they offer overnight accommodation and food as well. I would say most of the patrons are not new, but rather come from Lila's Block. No one knows for sure how many people were actually staying in that building, and I know I have heard up to towards 70 people were actually in there. So when they were staying in there, they weren't out and about in the way that they are now, so it wasn't in everybody's face the way it is today. Our staff continually talk to the patrons about respecting private property, about not loitering or littering on public and private property. We do not allow sleeping during the day due to the following. Bunk areas need to be cleaned thoroughly each day to prevent bed bug infestations and for health and safety reasons. Due to cleaning in the day, doing laundry, and other items, the staff are unable to monitor the bunk areas, so the doors are closed and locked during the day. The lounge area is not large, and with having to accommodate doing laundry in there as well, we don't have a very large space for people, so unfortunately we do not, once again, allow sleeping in the lounge area. Because of this, and not allowing sleeping inside during the day, we are seeing people outside on the grass sleeping. We know that with the meth use, lots of times people are up for days, so when they want to sleep, they want to sleep, and that obviously can happen during the daytime. It's not just a nighttime activity. We have an intake worker at the door that checks in all bags and gets individuals to empty out their pockets. Bags of any kind, including purses, are not allowed past the intake area. We also check for weapons, as they are not allowed inside the facility at all. We had hired one Northwest Security 3 months ago in hopes that their presence would deter maybe the behavior inside the shelter, and today is actually their last day, as we feel the money should go towards hiring additional staff that can provide more support that is needed. They have been working from 6 at night to 6 in the morning. We currently have 3 8-hour shifts, Monday to Friday, from 7 to 3 and 3 to 11, and we have 3 workers, 2 doing laundry and cleaning, as well as doing their best to support the patrons in what they need. And then from 11 to 7, we have 2 staff on. On the weekends, we have 2 12-hour shifts with 2 staff per shift, which we realize is not enough staff, because that's usually our busiest times. It is important that I state that the Friendship Center was not part of the decision-making regarding closing the shelter for 45 days, and I was only made aware of the decision 2 hours before the public announcement was made. I was not made aware of where the media release was taking place, or I would have attended. So, steps forward. We have hired a comprehensive management team whom we have been working diligently on staff training, enforcement of rules, intake process, along with staff and patron collaboration. What we were and have been working towards, daily job boards, restorative justice practices. So if damage gets done inside the shelter by an individual, we would have them repair it. Life skills, scheduled programming with external partners as well as our own internal programs. And researching other shelters in Canada to figure out what they're doing, what are some of their best practices, and how can we format them and adapt them to our community. Our staff have been quite resilient and work in an environment that is not always pleasant. And when I say this, I do not necessarily mean that they are being verbally assaulted or physically mistreated, but more along the lines that there are individuals who should not be in the shelter, but they should be in a healthcare facility due to their medical needs. The shelter is not a treatment center or a medical facility. However, many of our vulnerable people, which include seniors, young people coming out of care, and young girls have no place else to go. We are not a judge and jury, and we never take this kind of approach with anybody. Everyone has a story to tell, and some are much worse than others. I truly believe that no one sets out in life to become an addict, or for some, life's path can be very dark and lonely. As human beings, we all need love, hope, and compassion. And let's face it, there are those that have never been given any breaks in life to have hope, or have even experienced what it is truly like to be loved, and to have someone who truly cares whether you live or die. I would say most people in this room, including myself, either know or have a loved one that's going through an addiction or has an addiction. We as a Friendship Center have made a commitment to the people, and despite the fact that the doors will be closed for 45 days at the shelter, we will continue to carry through with our commitment. Our shelter workers will be doing outreach out on the streets during this time to provide food such as sandwiches and water, making referrals to services, and ensuring people are all right and as safe as they possibly can be living on the streets. We have some individuals that we know will not survive being on the streets, so we are actively working on getting them placed so that this does not happen. I will also be working very closely with our partners and management team on whatever needs to be done when the shelter opens in 45 days. So I thank you for listening, and my hope is as a community, we can work together. Thank you.